but now it has become a very complex problem because this disease is very quick transmitted from person. Including we now Google Go Suite from education, Google Classroom, Zoom, Google Meeting, and other. The implementation of educational program, the implementation of educational programs in university must priority and the principle of making it easy or not difficult from learning during the pandemic. The university also maintains the quality of education in this pandemic period with appropriate learning innovation, using exciting resource and high lecturer competence so that the quality of learning can be maintained. With the problem of learning and maintaining the quality of education as a result of the COVID-19, it's very important to our program in international seminar this morning, where we will talk about uncovering the word nursing, uncovering the word nursing learning strategies during COVID pandemic era. And I believe that the speakers are very competent in their field, who will discuss us among other. Keynote speak Mr. Dr. Hari Fadila. He will talk about policy and strategies of the International Nursing Association as professional organization during the COVID pandemic. Professor Chen, he will talk about medical and health information management, the development of the electronic medical record. Mrs. Email, she will talk about short-course education in nursing. And Mr. Rudolph, he will talk about impact of COVID on nursing education and future learning strategies in nursing students. And speaker from FIK UNISSULA, Mr. Endang, Mrs. Endang, Mrs. Nutricia, and Mrs. Swian. Hopeful this event can provide a solution for us in order to continue the learning of our students so that they can still achieve to target learning that have been set. As the Dean of FIK UNISSULA, apologies if there is something missed in this heart of all ladies and gentlemen. And I would like to express my gratitude to all the commitment for this event. And hoping for the help of Allah Subhanahu wa Ta'ala, international seminar and this event is officially open. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
The reading of Doa will be led by Nurse Muhammad Abdul Rauf MKAP. Mr. Abdul Rauf, please welcome.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Ladies and gentlemen, let us pray to Allah Subhanahu wa Ta'ala so that the event we are carrying out today can run well and get the pleasure of Allah Subhanahu wa Ta'ala. I will lead the prayer in Islam. For non-Muslims, please adjust it. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين حمدا شاكرين حمدا ناعمين حمدا يوافي نعمه ويكافي مجيده يا ربنا لك الحمد كما ينبغي لجلال وجهك الكريم وعظيم سلطانك اللهم صل وسلم على سيدنا محمد صلاة تنجينا من جميع الأهوال والآفات وتقضي لنا جميع الحاجات وتطهرنا بها من جميع السيئات وترفعنا بها عندك على الدرجات وتبلغنا بأقصى الغايات من جميع الخيرات في الحياة وبعد الممات إنك على كل شيء قدير اللهم طول أمورنا ونور قلوبنا وثبت إيماننا ووسع رزقنا وصحي أجسادنا إلى الخير قربنا عن الشر بعدنا إنك على كل شيء قدير اللهم سلم ديننا وأنفسنا وأولادنا وأهلنا من أفات الدنيا وعذاب الآخرة اللهم أعنا على ذكرك وشكرك وحسن عبادتك اللهم أرنا الحق حقا وارزقنا اتباعه وأرنا الباطل باطلا وارزقنا اجتنابه اللهم انفعنا فيما علمتنا وعلمنا ما ينفعنا اللهم اغفر لنا ولوالدينا ولجميع المسلمين والمسلمات والمؤمنين والمؤمنات الأحياء منهم والأموات اللهم إنا نسألك رضاك والجنة ونعوذ بك من سخطك والنار ربنا تقبل منا إنك أنت السميع العليم وتب علينا إنك أنت التواب الرحيم ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار وصلى الله على سيدنا محمد وعلى آله وصحبه وسلم سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين السلام عليكم ورحمة الله وبركاته.
To all participants, our keynote speaker for this seminar is the chairman of the Central Executive Board of Indonesian National Nurse Association. Now, I would like to read the CV for Dr. Harif Fadilah. Name, Dr. Harif Fadilah, SKP, SH, MKAP, MH, and for organization for last 10 years, President Indonesian National Nurse Association, 2015 and 2020, General Secretary INNA from 2010 until 2015, Chief of Nursing Compartment of Indonesian Hospital Association from 2018 until 2020, and education history. He is Master of Nursing Management, University of Muhammadiyah, Jakarta, 2017, Master of Law held Unika Sugiya Pranata, Semarang, 2018, Doctorate Study in Nursing Erlangga University, Surabaya, 2020. And then for occupations, he is Nurse Jakarta Islamic Hospital, 18 until 2015, and Electoral Faculty of Nursing, University of Muhammadiyah, Jakarta, 2003 until present, and he is a lawyer, Harif Chandra and Associate Law Firm, 2009 until present. And the title of material presentation today is INNA Policy and Strategic as Professional Organization in COVID-19 Pandemic. Without any further ado, please now help me welcome our keynote speaker, Dr. Harif Fadilah, SKP, SH, MKep, MH.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, everybody, the audience, the Honorable Dean of Nursing Faculty UNISSULA and Academic CPT, and then the Honorable our guest, the next from other country. Thank you for coming here. And then participant, all of the participant in this seminar. So I would like to thank to UNISSULA to give me opportunity to attend to this seminar, so we can exchange information about the Indonesian National Nurses in the Association role and function, especially in the pandemic COVID-19 era. Firstly, let us introduce us Harif Fadilah as the president of Indonesian National Nurses Association, representing Indonesian nurses to express our deep sorrow for the death of nurses in the world due to COVID-19. As of today, the number of Indonesian nurses who have died 262 nurses until now. So that let us we bless our God. Furthermore, let us share a few of the INA role and function and how to role of INA in COVID pandemic right now. So I would like to share my presentation by myself. It's clear, everybody? Yeah, I think so. I hope we can see our slide clearly. Yeah. Okay. The title of INA Policy and Strategic as a professional organization in COVID-19 pandemic. Okay. It is my curriculum vitae. MC MC was mentioned, yeah. Okay. So they outline this presentation. The first role of nursing professional education according to the law, Indonesian Nursing Act number 38 2014 concerning nursing. Maybe I would like to focus in this act because so many acts to building the nursing organization professional in Indonesia role and function. The second, the role of PPPN or INA, and the third is the role of PNI in building the nursing workforce in Indonesia, and the last is INA or PPNI in COVID-19 pandemic in Indonesia. And maybe in the 30 minute next, I hope we can give information. Firstly, INA PPNI as a professional organization for nurses in education. According to Indonesian law, so many regulations according to Indonesian Nurses Organization. The foundation is Act number 17 2013 concerning community organization. The second Act number 38 2014 concerning nursing. And then Decree of Ministry of Law and Human Rights number NNN. It is the foundation of exist and positioning of the Indonesian National Nurses Organization Association. Because in Indonesian law, every organization have to under the law by regulation. Yeah, it is the foundation. And then role, duty, and function. We can see in the Act number 18 2002, and then Act number 38 2009, etc. I would like to focus on Act number 38 2014 concerning nursing. Yeah. Okay. Nurses Professional Organization, or PPNI, according to Act number 38 2014 concerning nursing, we have a role of PPNI as a coach, as unifier, as developer, and as a supervisor to for nursing in Indonesia. What the nursing in Indonesia aspect? I think every aspect of nursing in Indonesia, services, nursing education, and nursing work-life condition. According to that text, INA as the vessel to gather nurses national and is legally incorporated according to the applicable regulation must be in Indonesia. Yeah? The purpose of nursing professional organization is to improve and or develop the science and competencies, the dignity and ethic of the nursing profession. And second, it is the very important right now to unite and empower nurses in supporting the national development, especially nurses for all of Indonesian provincial district, yeah, and until the village, yeah. Okay, so how about the role in building the workforce? The workforce is building starting from the education sector, yeah. Firstly, the education sector. We have now the orientation of the nursing organization, especially in Indonesia. We have three orientation. Firstly is education sector. Second is services, nursing services sector, and the thirdly is work life or nursing environment condition sector. Firstly, how about the education? The professional, we have to building the professional standard of nursing education. What the effort of INA? Development of national standard of nursing education. Together with the Ministry of Higher Education, together with the Ministry of Health and Educational Institutional Association, together, we have to build the national standard of nursing education. Right now, the progress is more than 80% have discussed with the stakeholder. We hope in this year, maybe or 2 or 3 months late, we have issued this standard of nursing education in Indonesia by Ministry of Education and Culture. Yeah. The second to advocate is a synchronize of the curriculum of education and standard of competency. I give you information about right now we have the standard of competency was issued by Ministry of Health. The number of decree of Ministry of Health is 4 to 5 Ministry of number 4 to 5 2020. Yeah, this is a grace information to you to you of all. Yeah, because the standard competency is to be a basic other aspect. Yeah, develop and optimization of nursing collegia. Yeah, Indonesian Nurses Association have formed the 8 collegium. We call in Indonesia collegium. We have 8 collegium. The firstly is collegium of psychiatry nursing, maternity nursing, pediatric nursing, and then medical surgical nursing, community nursing, leadership and management nursing, nursing cardiovascular, and oncology nursing. We have 8 collegial. And then we have the coordination of management of nursing higher education about the curriculum development, especially not for all the curriculum, because the curriculum is maybe we have to know about a curriculum is obligation of the nursing school institution, yeah. But how to the role of INA is only we give the profile and learning outcome input to the curriculum, yeah. And then professional and competency certification, yeah. Professional and competency certification, we to the student have passed the exam, yeah. And monitoring of the quality of management through the national competency exam, yeah. INA is a member of national committee of national competency exam, yeah. And then through the accreditation of nursing program in higher education institution. Because INA one of between 14 organization as founder of Lampetekes, yeah. And then INA can give the direction and policy how about to conduct the accreditation of a nursing program in higher education institution. And second, the role in building the workforce in the service sector. In the health to development and improvement of professional nursing practice. What the effort consists is advocating regulation for nurses professional, like Nursing Act or Ministry of Health regulation, yeah, as implementing of the acts, yeah, and then development standard of provision, like standard of competency and standard of practice, include the standard. We have the 3 of new grade standard we know we in Indonesia called SDKI, Standar Diagnosis Keperawatan Indonesia, or Indonesian National Nursing Diagnosis Standard, Indonesian Nursing Intervention Standard, Indonesian Outcome Nursing Outcome Standard. Yeah, we call the 3S. Yeah, 3S. Yeah, and Professional Code of Ethics. The coaching of professional attitude and behavior in practice setting. Yeah, it is the role of very important to us. Yeah, the implementing of the latest science and technology invention in practice include in standard. Yeah, it is very important right now. Yeah, and improving the obedience toward the code of ethic of Indonesian nurses. Yeah. And then we give the input to the management of nursing services. We have default as a suggestion toward whatever nursing service system, including referral system. Right now, we don't not too clear about the referral system in nursing, because we have a workforce in a nursing workforce in the hospital, for example. Yeah, not to to format the 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 standard of referral system, because we don't have much the nurse specialistic uh, pass from the higher education. Yeah, and care provision method, quality monitoring, a career path pattern, and positive work environment is very important in this service. Yeah. So INA have a suggestion and give input, thoughts, and policy brief to the stakeholder to handle it. And then role of in building the workforce, a strong nursing workforce with the purpose of welfare. Yeah, and enrich a professional life is the both of a very important aspect in our work life as a nurse and nursing in Indonesia. Uh, Work life, I think the focus in the scope of obligation, right, and responsibility of nurse and nursing. What the effort, we have to a professional recognition according to the scope of authority, competency, expertise, education level, and responsibility with the workplace or in the community, including pay or salary of nurse. The second obligation and right to gain continuing education. It is the focus on INA role about the CPD. Yeah. And third, source of for nurses to be ready and responsible to their nursing intervention. And the last, protection and advocacy for nurses in doing professional nursing practice include the law protection to our member. Special for continuing professional development in nursing. So how the in our role is establishing policy of regarding CPD, because the Nursing Act or Health Professional Act give the our authority to establish of CPD in Indonesia. Yeah. We are very happy in Indonesia about the Nursing Act or Health Professional Act give more role to the national organization profession. Yeah. Uh, and we have to together with the nursing council to build the uh, professional development in nursing. Yeah. The second, developing guidelines for CPD, and then establish standard of competency training and providing recognition credit for participation in activities to achieve competency, and organizing competency training activities independently or collaborating with the other parties, especially in training workshop with other, for example, the hospital, training institution, in district government, provincial government, and other. So the third, the last, the topic, what I want to share to you is how about INA or PPNE in COVID-19 pandemic in Indonesia. We have the strategic focus, the three strategic focus to be a guideline to our component in INA, for all structure INA in Indonesia. The first is strive so that nurses are not infected and do not become a source of transmission of COVID-19. It is very important because nurses can give service so many people as a client, and then so they have to have not to infected and do not become a source of transmission of COVID-19 for others. It is very important. So the second, providing the best and latest nursing care in accordance with the development of COVID-19. The best and latest, latest is update nursing about the COVID-19 nursing care, because the COVID is the new disease, the new character, and then the new technology. I think that is we have to the nurses for all of Indonesia, especially to directly care. They have to know about the new character of COVID-19. The third, strive to increase public understanding in preventing the transmission of COVID-19 through education people around their neighborhood. It is important because the nurse in Indonesia mostly in their home, not apartment, in their home, and they have the neighborhood. It is the goal of the nurse education, non-formal education, and I think this program can increase the belief to nursing in Indonesia from the community. So in pandemic, we have more action. Firstly, we forming a COVID-19 task force. Task force in central board and provincial board. So what the task of the task force? The first, mobilization resources and distribution. Mobilization for the donator or other organization or the community, and then distribution like PPA and nutrition, vitamin, to the nurses, to member, especially member who have give direct care, yeah, like in emergency department or isolation room, yeah. It is very important because the first in pandemic COVID Indonesia start, we have a limitation in PPA, yeah. So we have to mobilize and distribution uh, to them. Yeah. And then we are forming hotline service for INA members, and then mitigation program, and appeal to members to implement health protocol and infection prevention and control in the workplace. And then we develop the we increase the competency of nursing in handling COVID-19. Yeah, we conduct the daily and weekly webinar, and then we have to modify the CPD guideline according to the pandemic. Yeah. And then advocacy related to safe and quality practice. Develop guideline. We have a guideline for PPA. We have a guideline for nursing care. Yeah, in several unit in the hospital and community, and then socialization guideline for the nurses and collaboration with media. Yeah, especially the mainstream media. INA or PPNI COVID in pandemic have action too in advocate and support positive work life. Yeah. How about incentive? How about law protective? How about other need for nursing who give the uh, nursing care as a professional and safe? Yeah. Advocate and support psychosocial aspect. INA have collaborate with other organization like the uh, 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 what the organization psychologic organization to give free consultation uh, to them, yeah, who have psychosocial problem, yeah, in give the nursing care to COVID-19 client or patient, yeah. And then provide appreciation and compensation for the family of the deceased nurses. Yeah, it is the internal policy of Indonesian Nurses National Nurses Association. We give appreciation and we give compensation, a little bit money for their family. Yeah. And advocate and support protection for nurses in Indonesia in pandemic handling. Yeah, protection for nurses. Yeah, it is very important to us because the protection for nurses, it is. I think we have to collaborate with other organization, other institution. It is a very important because the nurse and other health professional is front line. They have a high risk in pandemic, yeah. And then advocating for and helping the diseases and nurses child get scholarship, yeah. We collaborate with the other organization to give the scholarship to nurses child, yeah, with Unilever, Min ID, and other etc. Yeah, and then build the networking with others, NGO, Ormas, LSM, health professional organization. We have together secretary, ya, atau sekretariat bersama with OP organization profession, medical association, midwife association, Pharmacists Association, yeah, and we collaborate, build networking with donor agencies, national or international, yeah, and then partnership program in public education with the other institution, yeah. And then support government program in handle COVID-19 pandemic include the vaccine national program, yeah, with the central government, provincial government, district government, and national task force handling COVID-19 or NTFHC. In Indonesia, we call Satgas COVID Nasional. Yeah. How about INA and Satgas COVID Nasional or National Task Force Handling COVID in BNPB? Yeah, INA is a member in Health Services Department. How do INA give input in increased nursing competencies? Especially right now have been conducting is training for critical nurses in 10 provincial 10 for 10 provincial in Indonesia. So it is the input from INA, yeah, and health services optimization, especially about the community health nursing, yeah, to through the OFON program, One Village, One Nurse. And health professional protection, yeah, it is the second part in the NTFHC is the new department in NTFHC in Satgas, health professional protection. We have 8 program, telehealth. Telehealth, like you can see the picture, helpline 117 extension 3. It is very important. I give you to you this information. It is the how to help our health professional, special for health professional, not for general patient. Yeah, only for the uh, health profession like medical doctor, dentist, nurse, midwife, a pharmacist, radiographer, laboratorium technology technician, and other health professional. So we have services, support, evacuation, referral to uh, hospital, drug, special drug, medical action, and laboratorium, PCR test, and plasma convalescence support, and specialist consultation in for the doctor. Yeah, so it is very important to you. Please, if you get the problem as a patient COVID-19, have you if you have a problem in the care, please you contact 117 extension 3. And then we collaborate to prevention and training for health professional. We support the plasma convalescent. We support the drug and health
Pardon me,
equipment,
Mr. Harif.
and we support health facility
Your
and
your time
evacuation.
remaining 3 minutes.
Especially, it is about the referral, and we building the standard professional
Pardon me, Mr. Harif.
operational procedure. We evaluate the regulation, and we have to give the law protection to the health professional. And then we have to investigation
Pardon
to
me,
the
Mr.
health
Harif.
professional was died. Yeah, how the causes,
Pardon, Mr. Harif.
and we can anticipate next if we know about the causes of death, nurses or other health professional in pandemic.
Pardon me, Mr.
And
Harif.
then tracking and social support. Okay. So the education and training COVID-19 special is advocation safe campus. Yeah, we have to collaborate
Pardon me, Mr. Harif.
with the several campus how to make the safe campus. And then limitation
Mr.
direct training
Harif.
is preferably training in the laboratory if you have. And then we suggest use technology. Yeah, it's very important to limitation contact with the other. Yeah. We have a seminar in Bapena PPNI. Right now we have 2020 days. Yeah, 2020 time seminar since April 2020. Yeah, it is very long program. So it is we have to give to our member to their opportunity to increase the competency information about COVID-19 in Indonesia. Yeah. How about workshop? We have to conduct the workshop with COVID-19 protocol. Yeah, less L. Yeah. And they have to use the paid platform. Yeah, platform. Okay, it is the wrong spell. Yeah, platform. And the composition in workshop, 2% to 20% face-to-face learning, if maybe, yeah, and 80% online learning. It is the blended learning. It is the policy of INA if any workshop right now in Indonesia. And then training specific competencies like emergency nursing, pediatric nursing, maternity nursing, yeah, operating theater nursing. This is specific competencies training for nurses. Yeah, we have to conduct the training with COVID-19 protocol, and we have to use paid platform, and the composition in training is 30% face-to-face learning and 70% online learning. Yeah, blended learning we have to do. Yeah, I think that is have to what will what I give you information about the Indonesian National Nurses Association role and function, and how to contribute the INA in pandemic COVID in Indonesia. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
To all participants, it's time to material presentation and discussion of an international seminar with a theme uncovering the world's nursing learning strategies during COVID pandemic era in 2021. The presentation will be divided into 2 sessions, each with 3 speakers. To the participants, please fill in attendance form and evaluation as a condition for getting a certificate. And for participants who are joining the YouTube room, As a condition for getting certificate, please like, subscribe, and comment. Thank you. Now, we would like to invite Mr. Ahmad Ikhlasul Amal, MAN Nursing, Faculty of Nursing, Universitas Islam Sultan Agung Semarang. And he would like to lead the first plenary session. Now, I would like to read the CV of Mr. Amal. For full name, Nurse Ahmad Ikhlasul Amal, MAN. And for formal education from 2013 until 2015, Master Art of Nursing in Relano University, Philippines. And then for rewards, there are research grant for Association of Indonesian Nurse Education Center atau AINEC, 2019 Science and Technology of Health Research Grant for Ministry of Health Republic of Indonesia, 2020 Science and Technology of Health Research Grant for Ministry of Health Republic of Indonesia. And then for employment history, from 2015 until present is lecturer at Faculty of Nursing Sultan Agung Islamic University. And the list of organization from 2018 until present, he is a coordinator on student research development at Sultan Agung Islamic University. To Mr. Amal, please welcome.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Hi, everyone. Welcome to our international webinar today, held by Universitas Islam Sultan Agung, Faculty of Nursing. And this is the series or session for international foreign speakers that will give us a new case of nursing learning strategies during COVID-19 pandemic era. And I would like to inform you that although this session is broken in English, please don't hesitate if you want to speak or inspire your ideas. You may try to express any opinion in English, or maybe you can mix it with Bahasa if you want to try give the question to the speakers. Both of them are okay because everything is okay here as long as you try your best and not afraid to make mistake. There will be no right and no wrong here, but there will be a new room for improvement. So this is the safe place to all of us to learn English also together and also learn something new from our speakers today. Before we start the session, let me introduce myself. I will be the moderator today. Everyone always call me Amal, and the host already give the prologue of my CV. So first and the foremost, I like to thank the committee of this international webinar for arranging this webinar and giving me a chance to become the moderator today. We are pleased to inform you that among us here, we already have 3 foreign distinguished speakers, and I would like to introduce you, and I would like to give a warm greeting. The first one, or the first speaker, is Prof. Cheh Yen Shu from National Taipei University of Nursing and Health Sciences. Good morning, Prof. Shu. Semarang is now.
Hello. Hello,
Hello.
Mr. Amo.
Hello.
Can you hear me?
Yes, sir. Yes, Prof. Okay. Thank you so much for coming and helping us for deliver your material today. Nice greeting from Semarang, Indonesia. Semarang is now 1 hour ahead from the Taiwan. Yeah. So the second speaker we have Dr. Emily M. Lopez, EDD, MENRN. I would like to make a warm greeting also. Hello, good morning, Ma'am Lopez.
Hi, Ahmad.
Hello, Ma'am.
Good
How are you?
morning.
Morning. Long
I'm glad
time no
to see you
see.
again.
Nice to meet you here in this best session.
Yes,
Okay.
thank you for the invitation.
Okay, ma'am. Okay, for the third speaker, we also have another distinguished speaker, Professor Dr. Rudolf Seymour Kirby Martinez, MA, RN, CAA, LMT, GSTP, FRIN from the St. Paul University of the Philippines, Tuguegarao. Good morning, Sir Martinez. Okay, maybe Sir Martinez will join later. So for the first session, we will have a great topic and with a great theme from Prof. Cheh Yen Shu, and he will deliver the topic of medical and health informational management, the development of electronic medical record and personal health record. So before the Prof. Cheh Yen Shu speech, I'd like to share his professional CV or curriculum vitae. Okay. Prof. Shu is from this CV. We know that already 32 pages, so I will not give all of you information for 32 pages, only for the first page, I think. So for Prof. Shu is now on National Taipei University of Nursing and Health Sciences as a lecturer. We can see here for his educational background. He is graduated for his PhD degree from the Ohio State University, USA in 1993. So I think for also the others field of expertise, we can see here, he is very expert in the medical record and informational technology and cloud computing standard and blockchain architecture in clinical informatics, information and biosignal processing, and biomedical database and data analysis. I think he is very capable for the first material today. And before we start Prof. Shu lecture, we need to inform you that first, today webinar is broadcast live on YouTube also. And if you want to give question during this presentation, just type your question in the chat box or in the chat room in Zoom meeting, or you can raise your hand. And at the end of the speaker session, as a moderator, I will invite you to activate the microphone So you can ask your question to the speaker directly. For Prof. Shu, we have 40-minute time for you to deliver your material. And for the Q&A, or question and answer, we will have 15 minutes. So without any further information, now we are moving on the one that we have been waiting for. I like to give time and welcome to Prof. Shu to deliver his topic.
Okay, thank you, Mr. Amal. So thank you, Mr. Amal. I am honored to be invited to this seminar. So I'm going to share my screen. So Mr. Amal, is this okay, the screen?
Yes, sir, clear.
Okay, thank you. Okay, good morning, ladies, gentlemen. Today I'm going to talk about something, a story related to medical data. I'm from National Taipei University of Nursing and Health Sciences, and I'm also representing Taiwan Association for Medical Informatics and the Taiwan Electronic Health Association. So the story is about the development of electronic medical record and the health information management in Taiwan. So happy to be invited to this international seminar. I would like to thank Sultan Agung Islamic University. So in the era of COVID-19 pandemic, I think the topic I decided to deliver the medical data. I think data is the most important topic today because this pandemic problem. So digital transformation of healthcare becomes more and more important in this situation. We know how to create, store, transmission, and access data is the essential. And we talk about 4P medicine, which is a good approach, I think. 4P medicine stands for personalization, participation, prediction, and prevention. Especially in the pandemic situation, people tend not to go to hospital, and we are depending more on telemedicine, long distance healthcare. So medical data becomes a very important key to perform the 4P medicine. Okay, here is a picture of a very old computer in 1962 Taiwan. That is the first computer donated by United Nations to Taiwan. But it is still in a vacuum tube architecture. But it never been used in Taiwan because it burned out the first day because the temperature is too high, and now the computer is in the museum. Okay, that is the map. I think everyone knows where Taiwan is. Okay, some data about Taiwan, our land area or population 23 million. We are becoming a so-called aging society. So age over 65 is more than 14%. Our GDP 22,000 per capita. Our national health expenditure is about 1,000 US dollar per capita, and the national health expenditure in GDP is about 6.6%, and our life expectancy was improved to 80 average. So some of the feature of National Health Insurance Taiwan, we are in a single payer, started in 1995, which is a universal coverage and a comprehensive and uniform benefit to everyone, who is covered, unlimited freedom of choice. That means no gatekeeper, easy access, and timely services. We can everyone who is covered by NHI can choose their hospital and doctors. And in Taiwan, the quality of healthcare is quite acceptable and in affordable cost. We have a very high public satisfaction, and because of the national health insurance in Taiwan, we developed a lot of IT information technology because all of the data need from the hospital need to transfer to the national health insurance. So the information technology need to be developed to fill for the purpose. Okay, here is some of the history of our health information network development from early stage 1988, 1998, and till now, from very basic connection to so-called cloud and later health cloud computing. Okay, so in Taiwan, the national health insurance is about 99%. No waiting list, basically, and because the national health insurance is so convenient, so the outpatient, the number of outpatient visit is still high, and that is the number of our physicians, and about 500 hospital, 600 hospital in Taiwan, and about 20,000 primary clinics in Taiwan. Okay, here is an important page in my slide. I show the major steps of the digital transformation of the healthcare in Taiwan. So first, from virtualization, I mean digitization. In Taiwan, it happens about 25 to 20 years ago. Most of the hospital become digitization. That means basically the medical record, the health record in the hospital, we try to virtualize those documents. So all the medical data becomes digit. After that, we enter an era of aggregation or integration. So that means the medical record used in the hospital, for example, the image, the nursing document are integrated into the so-called hospital information system. So all the professionals, including nurses, doctors, they don't need to go to a specific place to find the patient's data. So the patient's medical record can be reviewed anytime at any place. So that means aggregation. So after that, in Taiwan, not in a single hospital, we would like to exchange a patient's medical record between hospitals. So the problem becomes like a standardization and the exchange of EMR. So in this period of time, about 10 to 15 years ago, there are several big projects in Taiwan. We start to develop data format, standardized data format for the medical record. So the medical record between different hospitals can be exchanged. And that means a patient move from one hospital to another. The doctors and nurses in different hospitals can review the patient's medical record, even the patient is from other hospital. So from digitization, integration, and the exchange, it takes about 25 years in Taiwan we so-called digital transformation of healthcare. And after that, we entering a so-called intelligence. That means we would like to have so-called smart healthcare, which is basically based on knowledge. So we like to integrate. We like to put more smart or intelligence tools into our hospital information system, so that can help healthcare professionals to do the decision making. So okay, so here, okay, of course, the intelligence era is beginning now, and so there are lots of keywords such as artificial intelligence, cloud computing, lots of algorithms have been developed to help healthcare professionals to make smarter decisions when they take care of patients. So basically, the roadmap looks like this way, from the E to E means digitalization, mobile M, and the U means everywhere, and finally we try to become more intelligent. Okay, because I prepare much more slides, so I sometimes I think I will skip some of the slide. Okay, in Taiwan, we has the best healthcare system in the world. Okay, that is from the one of the magazine, CEO World magazine, because I think because we have we need to thank our national health insurance in Taiwan. So our healthcare system is quite has a satisfaction from our people. Okay, here is a very basic architecture of our national health insurance. You can see we have national health insurance IC card for everyone. The people pay the primary to the national health insurance. We have single payer payment system, and when we go to the hospital will provide the healthcare service to people, and we pay our co-payment to the hospital, and the national health insurance give the payment to the hospital, and the hospital need to send the claims data to the national health insurance. So that is the major important part for the IT, information technology, because all the hospital in Taiwan, more than 600 hospitals, they need to send their claim data to the national health insurance digitally. So that is a very important driving force in Taiwan to become digital transformation of healthcare. Okay, here is the basic VPN architecture of Taiwan's national health insurance. You can see there are several clouds. Here is all the hospitals, pharmacies, and clinics. Every day we need to send the data to the IDC, Internet Data Center. And here is the headquarters of National Health Insurance, and all the government, different government agency department can also go through the service center to get the data from IDC. So you can see in these 25 years, the cloud, the internet connections has been built more and more complete. So all the data in Taiwan, including most of the data, including clinical data, claims data, medical imaging, laboratory data, has been collected and stored in IDC, and the government can access those data very convenient. For example, the CDC, the Center for Disease Control, in the time of a COVID-19 pandemic, so the CDC can have a very real-time monitoring of the pandemic status in Taiwan, because anyone visit hospital, if the patient shows some kind of symptoms of the COVID-19, and the data will be transferred to IDC, and all the government agents department can be very convenient to access the data in real time, most real time. Okay, here is the health insurance card. You see that there is the chip on the health insurance card, and also we issue the card. We call this the professional card for the health care giver professionals, and this one is for all citizens. Okay, that is basic setting of our doctor's office. Oh, sorry. Basic setting of doctor's office. You can see basically there are two screens. One is for the text mode, and then this one is for the imaging. And you can the doctor can read the text mode and imaging at the same time. And here is the card reader, a basic card reader, and there are two cards need to put into the card reader for the doctor to read patient's data. Here you can see on the side is the doctor's professional card, and on the top is the we so-called citizens health insurance card. So only both cards are presented in the card reader. The doctor can access the patient's medical record. Okay, there here are the contents on the smart card, the health insurance card. Okay, the strategy plan is in Taiwan is to establish the national electronic record and the medical imaging exchange center, which has been done, and each citizen has his own electronic medical record. So that is means we have a personalized health record, and we would like to build interoperable EHR, which is our top priority. And the patient's record must be patient-centric, patient-initiated, and patient-owned. So that means everyone in Taiwan, the medical record is we so-called is the personalized medical record. Okay, here are some examples of the cloud computing in healthcare in Taiwan. So, all right. Then we have some of the figure I would like to tell you. In Taiwan, the national health insurance, we have several times of facing bankruptcy of the national health insurance. You can see here in about the year of 2000 and the year of 2010, and recently we are also facing another bankruptcy of our national health insurance, but the government did some of the management to avoid this kind of crisis of our national health insurance. Okay, today the major topic is about data. So we since the national health insurance collect lots of data from our hospital, so they are very easy to do the big data analysis, to do artificial intelligence. So we also keep the privacy and security, and we do a lot of use a lot of technology to protect our patients' data. So in the national health insurance, they create the so-called MediCloud to reduce ineffective healthcare spending, and also we have a so-called My Health Bank book to engage the people in their health management. This one is I think we'll talk this later, and the national health insurance also apply lots of AI application to do more precision medicine and healthcare. Okay, so from the medical imaging to management report, laboratory data, and the claim data, we collect all this data together and create a so-called big data center, a data warehouse to analyze those data, and those data can be used can be used on lots of policy making. So national health insurance, they are using data to create efficiency and save money. All the hospitals in Taiwan also need to create an information system to collect and analyze data to reduce unclear deletion from NHI. So that is both directions, because they are doing very good IT analysis in national health insurance. So all the data in hospital has to be used so that to avoid deletion from the NHI. So from 2000 to 26 to 2010, so we create basically a patient-centric, patient-initiated, and patient-owned architecture. Of course, the interoperability is so important. So So that include the functional interoperability and the semantic interoperability. So in Taiwan, basically, now the medical record usually they are HL7 file based. So basically, the Minister of Health and Welfare has already claimed that after 2016, we have complete EMR and exchange for all hospitals. Here are some very typical architecture of how we did for the medical record exchange from different hospital. You can see from here, different hospital through internet, different doctor in different hospital, they can use the so-called physician workstation through the internet. They can access patients' medical record from different hospitals. Okay, there are several architecture. I will not go into detail here today, but anyway, that is EEC from the Ministry of Health in Taiwan. We call this EMR Exchange Center. So doctors from different hospitals can go through this kind of services to retrieve a patient's record from other hospitals, and also the medical imaging. Okay, so the lesson we learned from our EMR project, the Taiwanese government issued the health IC card for everyone, which is with the unique identification number. So that is very important. We collaborate between software company and healthcare professionals. So we need to we got support from software company and the healthcare professionals. Otherwise, the project cannot be a success. And also the single payer health insurance in Taiwan has a positive effect on developing medical standards. So that's what I mentioned. Because it is a single payer, our hospital need to send information, send the data to the health insurance, national health insurance. So so our hospital has to digitize everything in their hospitals. Okay, incentives should be offered to the hospital that share patients data, patients EMR, of course. So there are some incentive, like if you share your medical imaging from one hospital to another, you will get extra insurance payment. Some example. Okay, regulation need to be modified before the establishment of EMR exchange center. The effective use of EMR should be emphasized in research and development of EMR. So the medical record can also be used in lots of research study to find to change the policy, to do more artificial intelligence analysis on the medical record. So we have a cloud-based clinical data repository. There are many things we need to solve. Okay, there are. I will just mention two of the major result. One is called the Pharma Cloud. This is the cloud-based medication record system. So that is it is very unique prescription cloud to give the doctor and nurses the patient's medication actively. So every time you go to see a doctor, the doctor will the doctor is able to review your current medication. Oh. Sorry. So that is a very unique one. So that can provide the query to medication to avoid the duplication of medication and the drug adverse event and overdoses. So another one we called it My Health Bank Book. This one are even better because launched in 2014. This one means all the patient can download their own medical record. And this one, so the patients can really access their own medical record and save their their record to a lot other place, and other place can manage their data for them and do their health management. So I will not go very detailed to the patient record, because the basic idea is that we can give the the patient's medical record access to different, not just the doctor, nurses, and professionals, and even give the patient's medical record to the health management society. So combine all together, we can create a so-called value-added application, depends on the patient health record. So, so the patient's medical record becomes information becomes value. Value means we can even we can save our data. The data can be value added, and we can even spend our data, because the data can be used to create more and more sophisticated and artificial intelligence application. So some of the example I show here to use your data, because if you can release patient's data to the artificial application, we can check a lot of overdoses or duplicate medication. We can avoid that. Okay, I will skip some of these. These are very detailed method we use to create applications. One example is that we can use the health data, single person's health medical data combined with the air pollution index to provide warning of air pollution for some respiratory disease patients. So, for example, here is for the normal people. But if you have, for example, acute respiratory infections, and your air pollution's colors will become this one. And that means depends on your condition. The air pollution has high risk for you. Okay, then recently we developed a blockchain architecture for the personal health record exchange. This one is a blockchain architecture, so that we go one more steps. The patient's medical record is not only exchange between hospitals. The patient's medical record can even exchange between countries. So because the blockchain is a cloud based, so we use the HL7 FHIR international standard to create this kind of architecture. So all the information can be exchanged between countries based on the international standard, and we use the blockchain technology to keep the privacy and the security of the patient's record. And also lots of health management and the disease prediction tools can also created and put on the blockchain node to provide services to do the precision medicine to help the professionals to do to do the prevention of the disease. So here is the architecture we developed, collaborated with lots of countries. We so-called Asia e-health information network, and the laboratory standard and the interoperability lab, Asia community of interoperable lab, COI. You can see this picture. People from different countries will work together to create this blockchain architecture of personal health record exchange platform. So now the platform has been used in different countries. Of course, include some people in Indonesia. Since this is very it's a cloud, it's a blockchain based. So every health professionals would like to participate in this platform. You are welcome to join and use this kind of platform. That means the patient's record can use this platform to exchange and transform between countries. Here are a very detailed flow. I will not go very detailed today. So we have published papers. So everyone, if you are interested in the platform, and you are welcome to go to read more about this paper and architecture and the management platform for blockchain-based personal health record exchange development and usability study, which is published in the Journal of Medical Internet Research. And another, we published two papers. Actually, this one is sustainability. It's also described about the blockchain across country PHR exchange platform. Okay. Since I think we have limited time, okay, I'm going to skip some of the detailed function of the blockchain. Let me go into big data topic. So volume, variety, velocity, and values are our major purpose for using big data. So here are another important slide I like to share with you. So from big data, we can create knowledges by human being or by the artificial intelligence. So knowledge can be created based on data. So we can use this data to practical applications. And those applications can be used to consumer. That means can be used in hospital. So from the hospital, we can collect more data back to our so-called big data center. So here are the smart healthcare. We use big data. It's kind of circle, so that we can create more tools for precision medicine for personal healthcare. So in our project, we also create so-called event-driven active learning disease prediction model. So that means we use this big data. I show you, we use the artificial intelligence to create lots of models. And those models can be used to help people to do health management and disease predictions. Use your data, use your status, go through a disease prediction model. We can tell the patients what kind of disease in the future they have higher risk. So we can do the prevention in the early stage. So this is some kind is a major research topic in my research lab. Well, we will create lots of disease prediction models for the doctor and nurses to use. Okay, so identify modifiable risk factor for disease, and we would like to do some kind of intervention to improve the disease risk factors to lower their risks. Okay, so there are some examples. You can go further to my slide. There are many examples to use medical data to improve health qualities and to improve clinical cares. For example, to reduce to find high cost patient, to to reduce the readmission, to do the triage, decompensation, and to reduce adverse event and the treatment optimization. So in Taiwan, we use of cloud technology to provide health information value-added services. That is an example of value-added example, but here you can see the people get sick. They are from lots of factors. So many factors will affect our health status, like our the brain, our organ impairment, and the material factors, psychological factors, our working environment, social environment, and our health behavior, and even our, of course, even the culture, and of course our genetic problem. So there are many risk factors to affect our health status. Now we try to dig out more and more data so that we can help the health professionals to take care of their patients based on medical record, based on the patient's environment. So there are also some of the publication from the New England Journal of Medicine. You can see we have social network, disease network, and the metabolic network. There are thousands of factors can affect our health status. So one of the example like here is also another paper published in New England Journal of Medicine. You can see from these pictures that is your degree of obesity depends on your friends. Okay, you can see if your friends are fat and you become obesity, you have 45% become obesity, and if your friends you have 25%, and if your friends you have like 10%. So that is here is an example of social network. So a lot of risk factor can affect your health status. So then we go back to 4P medicines: personalization, participation, prediction, and prevention. And all these depends on digitization of information of your medical record. So because of the time, I think, okay. So our meaningful use of EMR. Yes, we would like to create lots of use this medical record. So the purpose is that we would like to increase your entropy, and entropy is high, and the body and our health going down. So we like to use your medical record to analyze, so that the national health insurance will go from the fee for illness to fee for health. That means now even our national health insurance are doing a good job, but we are still pay for illness. We are not pay for health. Basically, National Health Insurance, they launched several projects. The purpose is to modify this kind of payment situation. If the patient becomes healthy, they will pay you more. So that is a different philosophy for the national health insurance. Okay, so we like to put people in the center and collect all the data, patients' data from hospital, from clinics, from institute, from nursing health institute, for example. So all the health information, medical information can be collected for the individual person, and the people's dietary record, exercise record, and biosignal record can also be collected together. So that means people in the center will create a personalized medical record, and that record, that data can be used to do the health management. Finally, we'd like to share one of the application for these COVID-19 pandemics. This one, we call it a global infectious disease surveillance and the case tracking model for COVID-19. This is also developed with other countries' help. And we also published this in the Journal of Medical Information journal, JMIR, Internet Research. There are some architectures, so we can track the patient, the travel of the patient, move from countries to country, depends on, because we have a blockchain architecture, I just mentioned about that. So this blockchain is closed countries architecture. So the patient move from one country to another, the trace, the path can be tracked in our hospitals. So I think my time is up. So there are some technology we used in this I will show here. So when you're using this COVID-19 tracking system, and the doctor, the nurses can track, can review the patient's medical record even from another country, and the system also shows the path the patient travels from one country to another. So it is easy to see how the patient moved from one area to another. This is we recently published this paper, and the system is able to be shared in our AHIN area, so the Asia Pacific country. If anyone you are interested in, you're welcome to contact us. So finally, electronic medical records are the base for any hospital. We have developed a very good EMR exchange platform in our country, but we are also build a blockchain and the FIRE-based cross-country PHR exchange platform, and also based on that, we developed a global infectious disease surveillance and the case tracking model for COVID-19. And those Pharma Cloud and the My Health book are the two very useful services provided by our national health insurance for the healthcare professionals to retrieve their patient's medical record. So that is also very important in this pandemic year, because just like I say, we can take care of patients, not even contact the patient. We can see patient remotely, but we can access. We have a fully access ability of their patient's record. So that are my presentation today. Thank you very much. If you have any question, you are welcome to ask. Thank you.
Okay, thank you so much, Prof. Hugh, for giving us such informative and amazing explanation. And now we will proceed to the Q&A session for Prof. Hugh. Let me see the chat room list. Oh, there is one person who raised the hand. Mrs. Novi Rohmawati, are you here? Hello, Mrs. Novi Rohmawati. Is there any question you want to ask to Prof. Hugh? Or in the chat room list? Okay, perhaps because a lot of participants are coming from nursing student or nursing participants, so maybe they need to adapt question or adapt your topic, Prof. Hugh, about the big data, cloud, and blockchain. But
yeah, if we have more time, I can explain more to nursing student, or in the future you will become the healthcare professionals. The digital transformation of healthcare is kind of important in the future, because we are going to use lots of we are going to face lots of patients, and of course we need the patient's data. So the patient's data is a very essential part for us to take care of patients. So of course we can still use paper-based medical record, but partially those data, if we can transform those data into digit, then the computer can help us to manage the data, to help us to do decision support. So computer usually calculate faster than our brain. So our knowledge can be created and put into the computer system to help us.
Yeah.
That's what I would like to say to add.
Okay, thank you, Prof. Shu. There is one question in the chat room, and this is coming from Mrs. Khairunisa. Prof. Shu, I have question. That was a great lecture from you. I would like to ask, what should I do as a nurse to develop technology in nursing area, especially in my city? Because I saw a big gap between Taiwan technology and Indonesian technology. Maybe you can give us suggestion, Prof. Shu.
Okay, what I should do as a nurse to develop technology in nursing area. Okay, I don't know. In Taiwan, we have a nursing the education. For example, in our university, the nursing department also we have some subgroups we call nursing informatics. So nursing informatics will focus on how we can develop our technology in nursing area. For example, from we have nursing diagnosis, we have assessment, we need to do our nursing plan. So we need to remember lots of knowledges. Of course, we already have we learned from our training. But if you have nursing informatics background, you will learn how to put together, to integrate all the knowledge into a system. So the system will help you to do the decision. So, of course, as a nurse, you need to have your training, basic training to take care of patients. But I would suggest if it is possible, because now, for example, to understand the system, it is not necessary to become an engineer to understand a computer system. So you should you should familiar with lots of, for example, we are using Zooms, right? So you should familiar with all the functions in Zooms. Even we use Line. I'm not sure you use Line in Indonesia. So you can use these tools to communicate with your patients from remotely. Okay, so basically, I would suggest to learn from learning tools first. So more and more computer tools you can learn that will help you to communicate with other peoples. That is the first steps. And if it is possible, I go to university and find some kind of nursing informatics courses provided. And also there are many nursing informatics courses internationally. So go to the website and download their slide and do some kind of study. That is my suggestion.
Thank you so much, Prof. Shu, for the
And of
information.
course, if you are willing to come to Taiwan, we have nursing informatics courses provided in Taiwan.
Of course, we will for the nursing informatic courses. And there is another question in the chat room from Mr. Sumarno Adi Subrata. Good morning, Prof. Shu. I'm Adi and I would like to ask, some nurses living in the rural area has financial problem to develop the technology to deal with the issue of nursing care in the course of COVID-19 era. What is your suggestion? And another question from Ahmad Huzaifi. I have a little difficult to follow lecture in this pandemic. So what is your solution? And you way to meet attend all my activity well at the same time maybe.
Okay, let me read the message. Someone living in the rural area has a financial problem to develop the technology to take this into university. What is your recommend to this country? Yeah, I think just like I mentioned, we don't need to use expensive tools. I see lots of people in different area. Um, they just use their cell phone and just like line to communicate with their patients. So my suggestion is still similar. Try to use some free tools to develop your connections. For example, we have line groups, right? The people you can see the patient's face. You can also develop even develop the data repository using not real data repository, but you can also use the data storage functions in line with your patient. So after if you are very familiar with those communication tools, I think you can still communicate with your hospital and just like I mentioned, I also create a so-called blockchain architectures for patients' medical record. That is also free to use. We have those blockchain architecture has been used in several countries like Philippines, Thailand, and India. So if any medical professionals willing to use this kind of platform, they are also welcome to contact us. Let me see. Another questions. I have a little difficult to follow lectures in this pandemic situation. So, what is your solution and your way for
I think the main question is about this, sir. Mr. Ahmad Huzaifi is confusing because this pandemic situation, everything is come in the same time, and what should we do?
So the final question, Mr. Amal, can you explain what will be what is the next the final questions?
The solution, because
Mr.
maybe
Amal?
Yes, sir. Hello, can you hear me, Prof. Shu?
Hello, Mr. Amal.
Hello, Prof. Shu, can you hear me? Dia tidak dengar. Hello, Prof. Shu. Hello, Prof. Shu, can you hear me? There is a problem. Wait. Okay, because there is a problem with the device from the speakers. So, Prof. Shu, I think the last question we will
好，
deliver.
那个
We will
这边
deliver.
看起来不见了。
We will deliver you for the email, and I would like
讲
to
完了，可
once
是
again thank you so much
hear
for
you.
your.
Oh, you can hear my voice?
Yes.
I cannot hear you, so I'm sorry.
Uh, 2 minutes. Hello, sir.
Yeah,
Can you
I'm
hear me?
finished here, but I just cannot hear you. Yeah.
Dia nggak bisa. Yeah. Okay, thank you so much
你关
once
掉，
again.
就像这个。
Because there is a problem, technical
I
problem,
don't know.
and the time is running.
刚刚又被人家打断。
We would like to give you a present appreciation from our
Hello.
today's occasion.
Yeah, I think you can hear me. So let me. I don't know if I answer all the questions. Okay, thank you very much. Hopefully we can have this conversation in the future.
Yes, sir. Thank you so much. Wait.
Okay.
And for the
Bye-bye.
last session, I would like to give appreciation to Prof. Chehyen Shu as the speaker of our international seminar today. And I would like to see you again for the next event. Thank you so much, Prof. Chehyen Shu. Nice to meet you here and hope we are in a good condition. And now we will proceed to the second speakers from Dr. Lopez. So now we are moving on the next second speaker, our second speaker, Dr. Lopez.
Yes, Amal.
Okay, thank you so much for the response, ma'am. And Dr. Lopez will give us a lecture or topics about South Korea's BTS, Best Teaching Strategy for Quality Online-Based Education in Nursing. Because we already know that BTS is one of the boy band, famous boy band in South Korea. I think it is really a very interesting topic because now BTS best teaching strategies that will deliver by Dr. Lopez. But before we go to Dr. Lopez presentation, I would like to share her CV, curriculum vitae of Dr. Lopez. Dr. Lopez or Dr. Emily M. Lopez. She's also my teacher, my lecturer when I was in the Philippines. And now she's become assistant professor in the Department of Nursing, College of Health and Welfare, Wosong University, Daejeon City, Republic of South Korea. We can see here a lot of achievement, educational attainment, and organizational affiliation that related to the topic that Dr. Lopez will deliver today. Without any further explanation, please welcome Dr. Lopez. The virtual floor is yours.
Wow, thank you so much, Amal. I'm glad to see you, and Harry too. Special greetings to both of you, my former students in the Philippines way back in Arellano University. 안녕하세요, 여러분. UNISSULA 로 chadehe chusoso kamsamnida. It means,
감사합니다.
hello everyone.
Selamat
Thank you
datang.
don't worry, I'm not talking in Korean or Hangul. I'll be speaking in English. It only means, with my greetings, hello everyone. Thank you, UNISSULA, Universitas Islam Sultan Agong, for your invitation for this international seminar entitled Uncovering the World's Nursing Learning Strategies During the COVID Pandemic Era in 2021. So this is a very timely, relevant seminar that we will be witnessing today, and we will be conducting in today's global pandemic affecting us in the academic world, in the academe, and of course the clinical practice. So in behalf of Usong Diakyo, WSU, Usong University, College of Health and Welfare, Department of Nursing, let me again extend my warmest greetings to everyone, to all the participants. I'm seeing 369 plus participants. We have a very huge audience comprising students, professors, of course, nurses perhaps, and other related field, but particularly in the nursing field of education. I would like to share my screen for this purpose of the presentation. Can you see my screen?
Yes, ma'am. It's clear. I can see your slides clearly.
Okay. For a while. There you go. So this is a topic related to our theme, which is on uncovering the world's nursing strategies during the COVID pandemic year in 2021. So I hope I will be giving justice to this theme of our conference, of our seminar, with me sharing with you what is the best or what do we consider as the best practice here in South Korea. And you might be wondering, BTS, wow, Amal earlier mentioned the popular boy band group, the K-pop group that everybody would know. Is it something connected with this BTS group? Well, I'm inspired with them, and I'm sure our nursing students will be inspired as well because of what they have with them sharing their self-love to their fans. So this would be also connected with us educators sharing the best teaching strategy for quality online-based education in nursing. So I will be sharing with you my personal and professional experiences and observation here in South Korea as one of the foreign residents for 5 years. I've been here teaching as a full-time faculty member in Usong University. And I am one of the 14 professors, 14 professors in the Department of Nursing, 6 of whom are foreign professors. So the other 8 professors are Korean professors. 2 of us are teaching, handling the professional nursing subjects, and the other 4 professors are taking care of the foreign languages. So they're teaching Arabic, Chinese, Japanese, Chinese also, and English on top of the other languages that these foreign professors are handling. And as I mentioned, the other 8 professors are Korean. Our medium of instruction is English and, of course, Korean. I also would like to acknowledge my photo sources, which I have utilized Wikipedia, Google, and Mike Taylor's Best of Learning Design Technology, and of course, Usong University, my school here in the Republic of Korea. So for this session, at the end of 45-minute lecture, you as my participants will be able to, one, be familiar with the learning management system, the LMS functionalities, features, and services utilized in one of the universities here in South Korea. It does not represent the entire South Korea's school system. So I'm only speaking the best practices that we have here in the school. Second, you'll be able to explain the value of LMS and the services it provides. Third, appreciate four elements for quality online-based education, or what I call OBE, although OBE is also another abbreviation that would speak of outcomes-based education. But this one is an online-based education in nursing. And last but not the least would be summarizing favorable responses on the teaching, learning crisis, challenges, and opportunities. So earlier, Amal also said one of his target outcomes would be learning something new on this conference, on this seminar for today. So probably one of those goals that we will be looking at, long-term goal, would be on us having some relevant information that we could use in the future, particularly for the nursing educators here in your respective schools or universities. So what's our take home for today after hearing what would be the BTS or best teaching strategy here in South Korea? But before we get started with the lecture proper, let me conduct a quick survey first among our audience. So I needed you to go to a website address that I will be sending in our group chat. How would you best describe or remember South Korea? Here. Or probably you could just type paulev.com/EmilyLopez459. So kindly go to this website using your cell phone or your computer. So try to answer this question. What comes to mind when you hear South Korea? You have two options to choose among these 8 options. So choose 2 answers. So as I have already activated this, we will see what your responses are. Actually, I use this Paul Everywhere survey also in my class. I use this for quizzes, for some interactive activity. So did you try logging in already and choose among these 8 options? Are you still okay? It has been activated, so you could choose your answer. Is it letter A on K-pop music and Korean drama, K beauty products and cosmetic plastic surgery, K food like kimchi, samgyeopsal, ramyeon, soju, flavored chicken, mandu, or is it on the K culture, tradition, values, the technology, the treaties on testing, treating, tracing COVID cases? Okay, I'm seeing some answers now. It's only one. Okay, let's wait for others to probably enter and respond. So let's have some icebreaker first before my lecture proper. While waiting for your answers, the other intention of conducting this survey is to walk you through, even for a short period of time, a virtual tour to the best features of this country in just probably 3 slides. Then later on, we will realign our thoughts into the essence of the topic entitled SK's BTS for Quality OBE in Nursing. So you could choose two options here. So we're seeing a lot on K-pop music and Korean drama, and of course with the K products and cosmetic plastic surgery, but basically more on the first two options that I have given. And the rest probably will just be secondary that we would be able to choose when you talk of South Korea. Okay, so last probably that we will be locking your responses. We have, oh, okay. Let me just write it down. Ooh, with the KTX as well. Recognize. Okay, so much with that. I will be clearing those responses. Thank you for your participation. And let me guide you through and bring you to this succeeding presentation of slides where we will have a virtual tour quickly of what South Korea can offer. So earlier, we just mentioned of the BTS as icon for this popularity worldwide. The K-drama, you can see Crash Landing on You, and of course, those food that would represent authentic Korean food, be it street food or to special cuisine. You have those ramyun. Wow, it's very timely. It's lunchtime. You might be getting hungry at this time with this food presented to you, shared with friends and with family as well. So we can see flavored chicken as well. And here you can see me wearing the traditional hanbok, probably walking on that area of the palace, to the busy streets of Myeongdong, to those tourist spots that shoppers or tourists would probably enjoy going around. But now, no more because of COVID. So with busy train that you have answered also, the KTX from Daejeon, probably, or Busan to Seoul, and that of the COVID response, internationally acknowledged, known with the 3 Ts of testing, tracing, and treating. As a community, will be building this mobile clinic for helping the government respond to this pandemic. And earlier, with Professor Su's presentation, I have learned something new today with Korea, second to Taiwan, in terms of the global access to healthcare index based on that CEO World Magazine 2019. But this one is 2017. And of course, with that technology, which does not get a vote from the audience with this internet connectivity that we consider fastest or world's highest, even in the remotest area. So we could see those best features, but how do we connect these photos or pictures in today's topic where um, we would see a common denominator on this global pandemic? So where do we connect, associate, relate this topic in the core or heart of any country or government priorities then? So I'll be using the heart mnemonics here that would best represent what is this BTS for quality online education is connected to. So of course, we would be seeing nowadays, health would be of top priority. How do we achieve health? Wellness. With a complete state of health and wellness, that would be captured from education, of course, as also presented by Professor Harry Fadila. What would be the role of nurses in building the workforce, starting from the education sector, and then bringing those graduates of us to employment, being nurses in the future, and using the EMR, using the technology with this challenging and environment that would be considered of global importance because of the COVID-19. And with other areas, agriculture, roads that may be directly affected with tourism, security, and social services in place. But basically, with the use of technology, how do we connect these? As you could see, health, education, employment, and technology in every country's government priorities that everybody would be affected, especially Asian and all over the world, that we would be seeing all those struggles that we are putting in place, that we will be able to share our own contribution to bring this best of health among us. Okay, so from E to E, we see this from education to employment, being hired in those world-renowned hospital. Top four, we have here in Seoul, Samsung, we have Seoul National University and Asian Medical Center, among others, that our graduates will be guaranteed of their placement, of their employment after graduation. So these succeeding photos will be seeing a common denominator even before the pandemic started. So let's see, what am I trying to say? With this pre-COVID classroom setting, yes, we miss this big classroom that we will be conducting our lectures, clinical post-conference, in a small group, that we will see those access, right, of technology, use of the technology. With skills laboratory setting after, of course, being hit by the COVID situation, then we could see that number decrease into 5 or 6 only students in the classroom, that they will be doing their activities in class. So here is our simulation lab currently, that we're seeing these educational practices in nursing education representing the classroom. Then you have the skills lab, and of course, clinical practice. And you might be wondering, are we still on duty? Clinical duty, yes, we are still deploying our student nurses in the hospital for their clinical affiliation and clinical assignments. Well, we could see that the educational system is really put into shock. Our educational routines has been challenged, has changed, has been modified. So these advancement of technological resources that we have here in Korea, we could also have a share of our struggles and learning to deliver what is expected of us in the academe. So we will be talking about those essential, relevant elements that would be bringing us to this so-called quality online-based education in nursing. So it's nothing new to us because we've been using this technological advancement in the system built in, but we will see some uh, changes that we will be looking at to what extent are we using this OBE or online based education. So let me walk you through with these 4 elements for quality OBE in nursing. I will call it as the 4 P's, 4 elements for quality online based education. First element would be on physical resources. What do we think of this technological platform in South Korea? Is it high, average, or low tech net connectivity? Well, obviously, as we mentioned, this is considered as the country technologically or technology haven, which would have to enjoy the fastest internet connection in the world. So even the remotest area, we will see very good connection. All students would have laptop, PC access everywhere you go. They could have this computer access and 100% use of mobile devices as well. So that's the first P element that would be necessary for online based education. Well, obviously, that would be on the platform that we will be using. In other countries, of course, I would recognize other technology that we are into. Then later, I will be sharing particularly what elements or learning management system we have here in Korea. The second P element for quality online-based education would be on processes. Now, what do you mean by processes? When you talk of the media that will be used, then you have that synchronous or asynchronous teaching. So for the College of Nursing, for the Department of Nursing, we are using the synchronous type. And I would know for some professors who would be uh, preferring other modalities or medium of instruction, then they are also free to choose that kind of asynchronous teaching. But of course, for the Department of Nursing, we do have that synchronous type of sharing this with the learners or with the students. And what are those teaching learning modalities or activities, interactive sessions that we conduct for our students? They would have a limited time for them to be absorbing what they would be learning from this session, from our session. And with third P, that would be on people, with that seamless partnership of the academic community that we are seeing here. So who are these people? So we are looking at, of course, the teachers. The core would be the students, the learners, and the third portion would be on the school. If I am to draw that triangle, then we will be seeing that teacher, learner, and that of the school partnership. But I'd like to add on, make it like a square or a rectangle, which would expand that academic community that would involve the family on this process of learning and teaching those students. So we should be able as teachers acknowledge and recognize, assess the learner's characteristics, and also uh, give gratitude and recognition to the school administrators, staff, and those officers that will be helping us in our teaching and sharing all these activities with our students. And of course, with that product, what is that product that we are delivering? Those courses that we have been assigned for a semester that would specify clearly what would be expected of these students to accomplish at the end of the semester. So we have these 4 P's, particularly in nursing. What do we have? What product are we producing at the end of the 4-year course in this college or in this school or in this department? So we're looking at knowledge-based, competency-based type of learners or graduates that would be caring, globally competitive, competent, and creative nurses, the 4 C's that would be seeing in this program outcomes of the universities. So caring canosa, we call it nurses canosa here. So them being skilled and competent, globally competitive, as we will be seeing a lot of foreigners also admitted in this institution or in the hospital setting. So welcome to WSU Usong Dihakyo LMS, our platform in nursing education, where we will be teaching and learning in the new normal in those areas that I've mentioned: classroom, laboratory, and that of the clinical setting standards. So here we would be able to see maximizing virtual education using LMS, the Zoom, or other online delivery mode system. And that would be other learning technologies like the vSim, virtual sim simulation, the educational videos that we used for that purpose, YouTube as a social media, and other web conferencing recording of lecture viewed by students at home, especially when they were absent in class. So we give them those lectures that we actually recorded during our Zoom session. So only those who were absent during the class time would be given that lecture. So as I mentioned, this platform, elements in nursing education that we have would be the first P in those 4 elements for quality OBE in nursing. So what are those functionalities and features in the elements world? So we are seeing here an official record of my teaching assignment, where last semester, fall semester of 2020, I was given 4 subjects here: International Global Nursing 4 and 2 for the 4th year, and that of the 3rd year with microorganism and infection control management and simulation laboratory. So this would be on this courses that I started off my semester. Last winter, we already finished that clinical practice with the virtual clinical management with a given group of students, 3rd year nursing students. So what are other functionalities and features in this LMS? So basically we start with this course creation, that we will be formulating the syllabus in this area, where we will be managing the courses, the content, by uploading it in the system. Not only the syllabus will be uploaded, we also have videos here that we could upload, and other files, assignments that we will be sharing with our students. So this would be done on a weekly basis, where we will see those schedules of Zoom session and those PowerPoint materials that we upload prior the scheduled meeting. Likewise, with those assignments that you could see here, that we will be uploading for students' submission in the system as well. So as they will be downloading it and then uploading their answers, then we will be communicating through this LMS. We also, as professors, will be checking on keeping a track of how students are working. We monitor those progress weekly that we will be seeing on that area of statistics where students' progress will be seen. And here would be that monitoring of students' progress, where you would see whether they have access, they have read that PowerPoint that you have uploaded, and with other, this would be for language professors, where they also do some of those writing and comprehension or communication activities. So basically, for nursing, then we're checking whether they have read all these materials that we have provided them prior the scheduled lecture. And with other assignments, can you hear my voice? Am I clear?
Yes, ma'am. It's clear.
Okay. So I just I have seen some chat in our message in the group chat that my voice cannot be heard. But anyway, so other areas would be on this assignments, uploading and downloading. So we're checking on this submission of those assignments. So if you click on this area, then we could see whether they submitted in time, or probably how many hours, how many minutes they were late in that submission. Other functionalities and features included in these elements would be, of course, the conduct of those examinations, assessment for their knowledge in terms of quizzes and major exams. So we will be formulating those items, be it open-ended or multiple choice, to item analysis that we'll be seeing how students perform in those quizzes. So each of those items, you could also view whether they got it correctly or incorrectly, and how many minutes did they finish those. This would be on a major exam, with them finishing in about 30 minutes. So with their performance as well, that we would see here, whether students would have difficulty on certain items, or how did they perform on those examination. So this would be on that conduct of quiz. We could also do this in this e-class, where majority of the students will be getting those quizzes simultaneously as scheduled. So here, whether it's in practicum or in classroom. Other functionalities and features in the elements that we will be seeing in this slide would be on developing learning portals, working spaces for learners' experiences as well. So this is not only on the teacher teaching or providing those lectures. We also provide students activities where they would be able to have those experiences of sharing what they have or learned, or probably create something new given the topic. Let's say in pathopharmacology, in health assessment, how will they deliver this in the form of, as you can see here, learning concerts. So these learning concerts that we will be posting with those guidelines will allow the students to work as a group with a given time. So they will be asked to present as well, showcase their creativity, or present some posters outside of this online um, or virtual presentation. They are also given that chance to showcase them and bring them in the school, in the corridors where others will also be able to see. So they will be able to communicate, collaborate, and create. So this would be on a higher level of learning, not only gathering those basic information, but also that portion where students will be able to share uh, their other skills. So this would be on initiating students' activities that we will be focusing on developing their skills. And this is in a form of contests that they will also be duly recognized and financially rewarded or academically given those certificates if they would be the winners on those contests. Other fixtures, of course, would be on those messages, notice boards, dashboard, which are common in other learning technologies with MOOC or massive open online courses created by some of the professors who would be interested to create these online courses. And of course, we do have this consultation portion that students personally, individually will be sending you messages, clarification in this system, or probably in Kakao message or email that they would be more comfortable um, asking those inquiries or clarification. What about skills lab? So I talk about more on the lecture portion on the classroom management. What about skills lab and the clinical practice? So here in their related learning experiences, clinically speaking, they would be assigned on the different areas or hospitals of affiliation in various hospitals here and in Seoul and in other clinical affiliations with specific preceptors that would be guiding them and us professors visiting them in the hospital. If not possible that we're not able to use this modality of visiting them in the hospital, then we do it virtually. We do have enhancement with the use of Elsewhere nursing skills videos. That would include answering provided quiz and this related nursing skills. So that would be part of those activities that we will be providing the students. And VCM or virtual simulation and conferences as may be necessary as well. So part of this, students will submit daily log for each scenario as they usually do with a clinical or hospital experience, that they would be writing what their learned insights are and their experiences, their observations. We do that as well in this virtual clinical learning experiences through the video, watching of those Elsewhere video or VSIM. So we have a lot of topics here that would cover MS, pediatric, maternity, women and child, with caring for the elderly, the basics of funda, pharmacology, health assessment, and psych nursing. So these conferences, virtual conferences or VC, may be scheduled, may be necessary if we have some concerns, problems with their exposures in the hospital. In the past, we have had one group pulled out from their clinical exposure because of some COVID um, patients that would be identified in that hospital. So we resort to this kind of conference or visual simulation. Aside from the daily log for each scenario, they would be having pre and post quiz, documentation, reflection paper, and summary report. So these are all seen in our LMS system where professors would be preparing all of this and grading them as well. So we're done with that fiscal resources that we would consider in South Korea. We wouldn't have problems in terms of the technology. There are times that we will be having some of these concerns with connection, but we will be informed ahead of time. We also have teachers assistant, student assistants who will be guiding the professors in case they would be having some of these technological concerns or problems. You could see here in this slide that I am using in my office room, or probably if I feel like going to the classroom to conduct this virtual class. We usually make use of two computers, so the desktop and my laptop, for that monitoring of students in the lecture session. So we would be checking on them. They are required actually to be participating by turning on their camera for the entire session. We also have established these policies, protocols, guidelines, and etiquettes for both faculty and teachers. So they are in place. And the thing, of course, would be it is supported by the university for this online delivery of lectures. You could see here their attendance is 20% of their total student grade. So they would be, as I mentioned, required to turn on their camera for the entire class. Should they be having questions, so they are encouraged to raise those. And with reporting time, break time, all well specified, with facilities such as classroom, laboratories, faculty rooms. They are provided with camera, headset, and teacher assistant or student assistant for Zoom concerns. Provision of face masks, shields, alcohol, regular fumigation. Those are part and parcel of our COVID response. No pass, no entry. So those pass stickers will be their ID, official ID, and uniform to attend on those classes if they would be having skills laboratory, depending on the situation in each of those localities. So we also have those regular temperature checking, use of the QR code. Right now, if there's no access to this QR code, then personal security number instead of hand phone number listed uh, to prevent those personal information exposure. So it's either of these two we could access so that they could attend those classes. Other learning resources, yes, of course, we would have online database containing nursing references, especially for research. So they would also be required to gather these papers and share what they've learned, particularly when we do have our clinical practice session with them. So with simulation, we have this state-of-the-art technology with the use of these mannequins and all those computers available in the laboratory for ORDR, for ICU, for pediatric cases. So nursing procedures with textbook delivered or picked up at students' preferences as well. They use the textbook as recommended, and they would be maximizing those materials given to them, aside from the PowerPoint materials that we are giving them. So with that first P on fiscal resources, we proceed to the processes. So as I mentioned, we are on this synchronous learning or teaching. So these would be having virtual classroom with Zoom, with live presentation, chatting, group chat, instant messaging with Kakao or via Zoom with live audio or video presentation. What about recorded audio or video? For other professors who prefer this, then they would be given that decision or preference should they want to use that for their classroom management. But basically, for the Department of Nursing, everyone else, 10 of us would be on synchronous teaching. So we are scheduled on this virtual classroom. So as you could see, some of those recently that I have finished my adult nursing practice 3 online last month. Okay, so what is this LMS in nursing education and services it provides? Let me go through with that learning. L, that would be, of course, targeting the domains of learning, the KSA, ASK, or SKA, the cognitive, psychomotor, affective domains by Benjamin Bloom's, or what we call the 3H in nursing, using LMS in delivering these educational courses. So the 3H in nursing, what are those 3H? That represents the cognitive. So, of course, we have the head part, and then the psychomotor, we have the hand part. And the last H, of course, would be on the heart part. So that would be on this learning acquisition on this KSA, or 3 domains of learning. With its management, of course, online or offline. Prior the new normal, I would say the LMS use is about 30% and 70% would be classroom offline instruction. But now I would say 90% would be depending on this online mode of instruction, and only about 10% as needed if we are allowed to do those examination and practical skills performance evaluation with 10%. So LMS basically is a good venue vehicle to organize these courses and deliver those valid and reliable information. And what system do we have? The process of bringing together the essence of teaching with the support of the school's administration and expertise of teachers and professors. I would be able to hear some of the professors having some concerns probably in other universities because they are into recording their lectures and then just using the asynchronous type of learning. So they might have some concerns in that. But with synchronous type, I find it beneficial for the students in this university. Okay, so with these elements in place, so that technological resources that we have, that technology that we are using as a physical resource to deliver that kind of learning with those of the 3H in nursing, with the skills, the hand part, with the head part, with that of knowledge, and with that of attitude, with that of the caring heart, with that small heart, probably that you will be familiar with those heart sign or symbol that we are using, with that of the big heart, that we could bring our 2 hands up in the head to show our love. And yeah, bringing our love with this my heart, own heart. So all of this would be on that learning aspect where we bring this to our students with the teachers and of course the school and the family. As the core product courses are delivered effectively, efficiently, that we will be able to use this LMS system or processes for the teaching and learning activities, so that we'll be producing this kind of nurses who are globally caring, competent, competitive, and creative nurses. So we are into this program outcomes or graduates that we will be producing. Question: as a nurse educator, how do we respond with these current realities and challenges in this new norm in today's global pandemic. So we have here the COVID-19 pandemic, actually, bringing us to this unprecedented educational interruption of unknown duration in the educational system. We have a limited conduct of traditional face-to-face classroom management, but in a week's time, we'll be starting our spring semester already. So it's still winter here. It's kind of cold and chilly, but not, of course, without this power supply or heat providing us in this cold weather like in Texas. So with hospital community related learning experiences still in place, but depending on the level of social distancing that we will be posted or kept informed with these concerns. So those students clinical immersion, actual bedside care, interaction to patient, client, nurses, and with this healthcare system may be disrupted depending on our situation. So we also have to be confronted with these issues on safety and sanity, with sound mental health also on the other side that we have to consider. So we're missing those actual session in the clinical area, but of course in the clinical or classroom and this skills laboratory that we will also be monitoring this skills development of students. So we have covered those four elements of physical resources, processes, people, and that of the product. And this assessment of this crisis, especially that we are now into this new normal, would be continually and regularly assessed. Otherwise, we will not be able to deliver what is best for our students. The second A, that we will be able to respond with this learning crisis, challenges and opportunities that would come our way, would be for us professors adjusting and adapting to this teaching learning crisis, where students, as we know, and teachers are both learning, adapting to the new classroom setting standards. So the content learning via these delivery modes like the blended learning or the flexible learning would be probably 50-50 online or offline, or 70-30, again depending on the leveling of social distancing. Here we have 5 levels of social distancing, with level 1, level 2, and 3 on the regional level, and then national level with level 4 and 5, or actually 1.5, 2, 2.5, and 3 leveling of social distancing. Obviously, if it's level 3, then this is all Zoom. But depending on if it's level 2, 2.5, then we could have more of this online compared to the offline instruction. So we use, aside from Zoom, our partner with the LMS, laptop, cell phone, iPods, and other gadgets to access to this information. So teaching modalities, there's a lot. You could make use of that Poll Everywhere to conduct your quizzes or other exercises, or Quizlet for this purpose that students actually would be enjoying while you are reviewing or while you are conducting your specific lecture. So part of this adjustment and adaptation on this crisis include, again, policy changes and recognition. With COVID-19, university will be responding based on the class type. So we also have to decide on which type of class do we prefer on this courses that we are assigned for the entire semester. So face-to-face classes for practical classes are set for approval. So you can see here, VISIM for nursing, medical, surgical, and with that of the other laboratories that we have for pediatric, for women, for adult, for ICU, and those access to those educational materials that we could make use of during the virtual class. So hospital community RLE with their interactive learning modalities in the form of SimLab or use of hypothetical scenarios would be in place, as I mentioned, with us having elsewhere nursing skills videos and virtual simulation where students will be participating on practical laboratory classes. So again, with this official ID that they would be using masks, face shields, and the access, the QR access before they could enter the university. And limited number of students that we will be seeing during those class activities. Adapting with an O, not with an A, with this flexible teaching learning platform that, of course, as teachers, professors, we should be able to update ourselves, adapt to teach the fourth or the fifth IR learners. What are these IR learners? The Industrial Revolution learners. So they're really techie savvy, but some of them you really have to guide as they will be entering those Zoom classes as well, where you will be providing them those activities. We as professors should attend professional updates as a way of learning, living, and teaching with this new norm. So here you could see from the traditional skills lab, clinical conferences, then we move on to this virtual conferencing or virtual conduct of instruction, both in the laboratory, in the clinical, or of course in the classroom. And last but not the least, we have the fourth A, that we will be assisting learners on achieving the learning outcomes by preparing the teachers to be capable of delivering what is expected of them as educators or instructional coach and advisors or counselors. So the virtual learning here in South Korea, what's the future? Well, it's basically accelerating the use of the technology here in the country because we have access already to that. But we still are on the process of improving those quality services with this prolonged flight of this pandemic. Live with the routine of social and physical distancing in the classroom and live with a kind of restrictions until definitive solutions arrive for the control and prevention of this pandemic. So as we assist students, teachers, and the school, we are also improving on Wi-Fi connection, learning to use, access what available online materials are there for us to use in our classes. And one of the issues perhaps that I would like to raise here would be on the conduct of evaluation exams with concerns on cheating, security restrictions of the use of Zoom. So now we would be having to indicate that password or passcode before students will be allowed to enter in the Zoom. Without those passwords, then you cannot actually access. Checking of students' attendance in Zoom with camera and audio on, turned on during the entire period with another gadget or using their handphone or cell phone used for monitoring purposes. If we cannot conduct the paper and pen examination for big class, then we, or small classes, we would be able to make use of this Zoom and their extra gadget that you will be seeing here. These are some of those students using their cell phone on the side, so they would be accessing that, and they would have to make a view of their testing site while they are also engaged into the Zoom during quizzes or major exam. So you use another laptop or desktop for you to monitor them while having those examinations. So this would be an example of this. You can do it at your convenience in your office, or probably go to the classroom for a bigger screen that you could monitor those students. What else do we have? Issues on social interaction with peers, where role of teachers as advisors, counselors, on top of being instructional coach. So this is really something that we should ponder on and we should consider as professors. With limiting or scheduling, reporting of students in class by student levels, maintaining the 2 meter of physical distancing, use of QR codes for entrance in the university premises as well. And the utilization of school facilities, libraries, labs, dorms, cafeteria, which are temporarily closed, would have some concerns or issues where students probably would be requesting for refund of their miscellaneous fees. Well, they would have to be informed that this would also be uh, going for disinfection and maintenance of the school facilities with regular fumigation of classroom, laboratory, faculty rooms, and of other offices.
Pardon me, ma'am.
Yes.
We still have 3 minutes remaining.
Okay. Okay, I'm almost done. So with this issues on education to employment of graduating students, 100% we are into this. And did we achieve these objectives of this seminar? Well, we could go back to this slide where we are able to see, and I was able to present to you the LMS functionalities features as a valuable tool used in this time of global pandemic for assisting teachers in school in delivering the best educational courses for students, developing of expected competencies and desirable attitudes. The 4 elements for quality OBE in nursing was also mentioned, with the 4 A's on how to respond on this crisis, with these challenges and opportunities that we already have summarized as assessing, with the 4 P's: adjusting and adapting virtually and professionally, assisting students, teachers, and the school. So the E2E, where we use these LMS technology for uh, educating students and producing those nurses who are globally competitive. Let me end with this slide by saying technology will never replace great teachers, but in the hands of great teachers, it is transformational. So this is by George Couros, one of the educational as consultant that we will be seeing some of his sharing as well with this online education. So as teachers, let us continue to inspire and grow with that commitment of being effective teachers with whatever heart that we have, small heart, big heart, or our own heart shown. The key to better quality education, be it online or offline, is to choose which teaching and learning would be best fitted for our lifelong learners, and make sure they will feel valued as we teach and influence the lives of people we touch. So we listen as well. So we could bring these 2 ears together. So you will have this new heart combined that will be showing your true heart of sharing with the students. So, what is this BTS in SK? I would say there is no one best teaching strategy to manage a course. There are a lot varied and valid strategies to teach and learn during and beyond the pandemic. What is the true meaning then of BTS for quality online based education? We mentioned about that BTS with the K-pop group. What does it mean? Beyond the scene, behind the scene, or Bangtan Sonyeodan. That would be the meaning of what really BTS is. But on my personal account, what is BTS? The true meaning of BTS for quality online based education is being there for students to teach as safely, sanely, and healthy as possible as nurse educators in and out of the classroom setting. BTS is also being true to ourselves. It's okay not to be okay. And we will be, of course, showing and sharing the self love through teaching. And lastly, what is BTS? Being thankful to the school for the seamless partnership and support at this time of global crisis. So, maraming salamat po. Thank you very much. Kamsahamnida from Usong University. So keep safe, strong, healthy, and think positive and be prayerful at this time of global pandemic. So if you have any question, I'll be more than willing to answer all your inquiries.
Wow, thank you so
Thank
much,
you, Amal.
Kamsahamnida, Dr. Lopez.
Yes.
Maraming salamat po.
Wow, you still
let
remember.
let us give Ma'am Lopez reaction with the applause reaction through Zoom Meet. And now we
That
will
would be
move
a
to
virtual
the
clap
now we will
from
move to the question and
question and answer.
answers.
Yes.
Anyone who asks question, let me know. You can ask the question through the chat room or raise your hand. Oh, there is a private chat to me
Mm-hmm.
from Miss Eva Himatul Ulya. This is my student in Universitas Islam Sultan Agung, Ma'am Lopez.
Okay.
So her answer is how large the impact on the amount of students or quantity of the student when joining online class regarding the transferring knowledge from lecturers to the students.
Can you repeat the question again? What is the impact of
Uh, how large the impact on the amount or
how?
the how large?
Large.
Yeah,
Okay. To what extent?
yeah. The impact
Mm-hmm.
on the amount of the student or the number of the student in the class when joining online class regarding the transferring knowledge from lecturers to the student.
Mm-hmm. Okay, that's a
Yeah.
good question. Very nice. Thank you for that question of your student, Amal. What to what extent or how large is that impact of the number of students attending the online courses with us transferring that knowledge? That would be a very good study to start with that we will be putting in place in terms of their responses there when we will be assessing, looking at the result of their quizzes with the result of their major exams. That would really show to what extent did they learn and capture that information or that learning, transfer of learning. So if we will be, I would say, engaging the students more than giving a lot of information, lecture during that virtual class alone, that would not be effective because there are other barriers that we have to consider when doing this virtual instruction. For instance, I just had clinical practicum virtual conference with the students, only about 19 of them, just a few weeks ago. And our topics would be on the stressors, conflict management in hospital setting. So I started asking them of which they would consider as stressors in life. And you will be surprised with those answers that would come up. And one of those would be saying mothers. In one word, that they would be saying a stressor would be coming from their family. One would be on sleeping as very precious for them to be learning. So there are other barriers that we should be aware of. As teachers, professors, we do not focus only on giving that lecture. Remember, I ended up with BTS being there for the students, being thankful for the school with all the support, with all the assistance given to us, that we will be able to provide this information effectively and efficiently to our students. Because there is no one way, best teaching strategy that would make the learning of information or acquisition of learning the best for the students. We should combine all those resources, all those methodologies for an efficient or that would bring that large impact. As of now, I cannot say to what extent or large will that bring that large impact on the students' learning. We have to conduct studies that would really show to what extent this effect on the number or amount of students attending in class would be on their learning acquisition.
Okay, ma'am. Thank you so much for your answer.
Mm-hmm.
And there is another question from the
Mm-hmm.
committee, Mrs. Indah Sri Wahyuningsih.
Yeah, I can
And
see that as well.
with the higher number of COVID-19 in Indonesia, we are currently conducting all online learning activities, including nursing practical skills for all our students we are doing online. How is that done in Korea? South Korea, we ask for your input. What is the right way to evaluate the skill of the student who's undergo online learning?
Wow,
Evaluation,
that
I
would,
think.
yes. At this time of COVID pandemic, in terms of the practical skills for all our students who are doing it online, it would be really challenging for us to check on their skills when they do it online. So I would be sharing with you, if as much as possible we can do it in class as the situation would allow us, it would be better to do it. But if we are given the opportunity for us to do it in online for the practical skills, what we are presently doing is with the supplemental video resources that we would be able to evaluate students learning based on what they see on those videos. So those elsewhere nursing skills, procedures, they would be watching and they would be answering those quizzes and they would be writing their reflection paper. So again, we could see this is more of knowledge part. But what about the practical side of it? How do we evaluate? When it comes to evaluation of the skills part of students' assessment, we should be able to be guided with the evaluation tool for that particular skill so that when they perform, we will be able to clearly check on those items that would require areas of improvement. So for the practical skills, we can also do that virtually, but we haven't tried it virtually. We actually schedule them in the skills laboratory for them to be doing it, and we will be grading them using evaluation tool. And as necessary, we would also be correcting or telling them which areas needs some improvement. And if they don't pass those items with asterisk important skills, they have to repeat. They are also given the time to practice in our laboratories. It is open they would just have to ask for a schedule. We call it open lab that they would have to polish. And they would be able to ask some assistance from us as we may be available. So, yeah, it would be challenging for online checking or skills evaluation of students. But we can still do that, provided you have the skills evaluation tool for you to be able to see. But the question here is, do you have, the students would have those materials when they perform? So if they would be given the chance to borrow some of those materials in the performance of those skills, then I think it would be also accessible, or it can be done.
Yeah. Thank you, ma'am. So maybe blended is better for the skills, for the material. Okay, any other question? Yeah, raise hand or in the chat room. So I think there is no other question, ma'am.
If there are, then please feel free to send me in my email. I would love to be of help.
Okay, thank you, ma'am, for your attention.
Yes.
So, because the time is also running, we would like to proceed. Before we proceed to the next speaker, we would like to also give Dr. Lopez a certificate of or appreciation to Dr. Lopez from our Dean, Faculty of Nursing, Sultan Agung Islamic University, as the speaker of this international seminar today, February 20, 2020. Thank you so much once again, Ma'am Lopez, Dr. Lopez.
Yes, thank you
I
for
hope
your
we can
invitation
meet
as well.
you in other occasion, and stay healthy for you and your family, and good luck for your career, ma'am.
Yes, thank you. I hope you also learned something from it.
Of course, ma'am. Thank you so much, Ma'am
Okay.
Lopez. So we will proceed to next speakers. Are you here, Dr. Martinez?
Yes, good afternoon. Good morning.
Okay, good afternoon, sir. We will go to the next session with other distinguished speaker. We have Sir Rudolph Seymour Kirby P. Martinez, PhD, MARN, CAA, LMT, CSTP, FREN. Wow, a lot of degree. And he come from St. Paul University of the Philippines, Tuguegarao. And before we proceed to the presentation, I'd like to share the CV or curriculum vitae of Dr. Martinez. Yeah. So Dr. Martinez is now the professor or the lecturer in the San Beda University College of Nursing and other university in the Philippines. And we can show here, we can see here the educational background of Dr. Martinez from the PhD candidate, I mean the PhD degree, and then other certification. I think we will take time if we write. If Hello. Let's proceed to the. Sorry for the inconvenience. Please join me in welcoming Dr. Martinez, our next speaker. The virtual floor is yours.
Okay, good afternoon.
Good afternoon,
So
sir.
I would just share my screen. Okay, now. Is my screen sharing here?
Yes, sir, I
Is
can
the
see.
slide clear now?
Yeah, I can see it clearly.
Okay. So again, good day. Salamat siyang. So my topic that was assigned to me is about the impact of COVID on nursing education, specifically the future learning strategies for nursing students. So some personal disclosure, I am currently connected with San Beda University and Arellano University as my place of work. I have no conflict of interest at the moment. And at the end of this webinar, I will give you a QR code for the handout. So you will have a copy of this presentation. So let's start the discussion. So COVID-19, as we all know, is a global problem and it will most likely stay beyond 2020. So we are not yet at the stage wherein we can say that COVID-19 has ended. It will continue to do its to wreak its havoc way beyond 2020 and 2021. With that, we know that all people are affected regardless of race, socio-political interest, culture, and age. And because everyone is affected, everyone will have experienced a sense of loss. And this sense of loss is actually the context where our student and the faculty is during the COVID pandemic. So here's the thing. While we want to teach student, while the student want to learn, they themselves are experiencing loss. Okay? Beside that experience of overall sense of loss of both the student and the faculty, we need to be reminded of these things. Number one, that it is not actually directly related to COVID that limits us with our teaching capability. No. The main reason why we have these limitations in our teaching modalities is because of the level of government response. The more that the government response would mean to mitigate or limit the movement of people, the more that they will do lockdown, the more that we will find it very difficult to have a face-to-face lecture. So beside COVID, bringing in a sense of loss towards the student and the faculty, our government, where we are located, how they respond to the problem will have an effect on actually how we will reevaluate how we will do the teaching in nursing education. So because of that, nursing is no exemption to this transition. Because there is a limitation of movement of people from the old face-to-face, we have transitioned into an online system of learning. Okay? And nursing is not an exception to that. But within this transition, we need to ask ourselves these three essential questions. Okay? This will be the focus of this talk actually, trying to provide an answer to these three main questions. So first, how are the students during this pandemic? So we need to emphasize that because we are educators, um, the prime aim of an educator is the student. Okay? That is our prime focus. Second question is, how prepared is the school to adapt to this new model of learning? And the third question is, how can we maximize this new system in educating future nurses? So we will go to them one by one. So let's start first with the student during the pandemic. Now, one thing is for sure, students are affected during pandemic. As I have mentioned, because there is a sense of loss, everyone is affected, including the student. So we are actually starting in a context where learning is not optimum. And there is a sense of unpredictability of the situation. The situation is very much unpredictable. We do not know what will happen next. And because of this, one major concern of students, according to the study of Savitsky et al. In 2020, is that they feel anxious most of the time. Okay? They feel anxious because of three major things. Number one is that there is an erratic response of the government in how they control COVID. Number two, they are anxious because their usual support from the society is disrupted or lost. Before, when we have the face-to-face learning, the student can actually talk with their fellow student if they are feeling anxious. They can go and eat some food. They could go and watch some movies. Now, all of those things, all of those processes are lost because of the pandemic. And another major anxiety-provoking instances for students is actually the unstable internet connection. Now, here's the thing. Student wants to learn. Okay? Professors want to teach. But most often than not, there's a problem with internet connectivity. Okay? Another problem that we have with students during the pandemic is that most of them have a negative attitudes on e-learning, okay, or online learning. Now, there are actually two major reasons why they have negative attitude. This was actually presented in a study by Diab in 2020. What was found in their study was two things. They are afraid or have a negative attitude towards e-learning because of technological infrastructure and the instructor's characteristic. So we need to be mindful of those things. Number one, they have a problem because they believe or they perceive that the technology will not adapt in itself. So if you believe that your internet connection in your place is weak, then you will have a negative attitude towards e-learning. That's one. The other thing is the instructor characteristic. Now, some of the students actually have this belief that some instructor would find it very difficult to adapt to an online platform. So with this thinking, this kind of attitude, they will have a negative perspective of the e-learning because they believe that their instructor will not be that effective in an online platform. And another thing is that most of the encounters in an online environment, some of them are seen as uncaring encounters. Now, we have done a study just recently regarding the uncaring encounters with students on an online learning system. And what we have found out is four basic things wherein they see those instances as very much uncaring. Now, this is very instrumental in nursing because in nursing, what we want to teach is caring. So learning should always be a caring encounter. But in an online setting, there are some instances wherein the student view it as an uncaring encounter. So when are those things or when does it happen for for thematic for themes that we have encountered? Number one, they see the internet online platform as uncaring if they feel there is a lack of connection between the faculty and the student. Okay, they view it as cold. So another uncaring encounter in an online system is number two, blurring of professional roles. So what's a blurring of professional role? They don't know what role are they trying to portray in an online system. Okay? Because most often than not, the professors will act as if they are the guardians. They would act as if they are the parent, but the student does not want those things. What they want is the professor to act as a professor. Okay? And another uncaring encounter that we have found out is that there is non-transparency. If they perceive that the administrator or the professor is not telling them everything, or not telling, or is hiding the truth for them, that is seen as an uncaring encounter. And the last one is, this actually happened. This is very much interesting. We thought that when we transfer to an online system, there will be lesser bullying. But we were not right. There were instances of bullying. This is bullying between professors and fellow professor, and professor towards student, and student to student. So it happens. So that's one concern in an online system. So what is the key now to preventing this problem in our student during the pandemic, especially in educating them during the pandemic? The key there is to have a stable educational framework and support to the student. Ask yourself, in your university, what support do you give to the student besides the internet? Okay. What framework are your institution following? So one thing that we need to ask ourselves, in response to our school trying to shift from a pure face-to-face system to a blended on or an online system, is that what is the general direction of the government or the university? Now, we need to be mindful of this one, because all of our action will be rooted to what is the direction of our government and university. For example, in the Philippines, our government aims to actually have a blended type of learning. They aim to open the school sometimes in the future. That is the direction of the government. Therefore, most of the institution is now preparing to actually have a blended type of learning, because that is the direction of the government. That is the direction also of the school. Whatever the direction of the government, it will be followed by the school. And this one will determine your approach to teaching. If the government does not want to open the schools for face-to-face, therefore you will not have a choice but to have a pure online system. So that's how important it is. So you need to be mindful of what is the direction that the government wants for education as a whole, not just in nursing, but as a whole. And research has actually emphasized that the best method of delivering education during the pandemic is a blended learning system. Okay? They said that blended learning system, when delivered purposefully, can positively influence the impact on that, and the influence and impact on the achievement of students. Now, what is so we have agreed that the blended learning system should be the one that we need to embrace in the future, in the new normal. But two things that we need to understand: that blended learning system needs to be culturally sensitive. Why? We need to adapt it. We cannot adapt fully the system from a developed country. For example, the system of USA, the system of Canada, they are developed country. They have different needs, and they have different focus than us, which is a developing country. So we need to adapt it. Another thing that we need to understand is that we need to be culturally sensitive in adapting the blended learning system, because our culture is different from other culture. So we can adapt the system, we can embrace the system, but we need to adapt it to our local context. Another thing that we need to be clarified when trying to adapt a system, for example, a blended learning system, is that, are the systems and processes in place already? Because you cannot fully adapt unless there is a system that is already functioning. Now, this is one of the reasons why we find it very difficult to transition, because we don't have actually a period of transition, because COVID happened. When COVID happened, what we have was emergency transition. We need to transition whether we like it or not. So the usual transition phase was missing. So we are doing transition while teaching. So that's why it is difficult for some, because the system and processes is still not in place. So what are the things that needs to be in place before we actually adopt a full blended learning approach? This is the problem actually of the administrator of schools and the leadership of nursing in its localities on a national and local level. One of the problems that needs to be addressed is the internet connection accessible, affordable, and reliable? It needs to be these three things. They need access, they need to be able to afford it, and it needs stability. Okay? If we have problem with the internet connection, then we will have problem with an e-learning activities. Next, are you using a learning management system? Are you using an LMS system? Is the school implementing an LMS system? Are you using Google Classroom? Are you using some form of an LMS system? Canvas, for example. So if you have an e-learning system, the next question is, are the faculty members trained in the use of this technology? Did we train our faculty to actually teach them how to use this LMS system? Or the basic, teach them how to use Zoom, teach them how to use Google Classroom, teach them how to use the other technologies necessary for e-learning activities to happen. We need to remember this. The faculty needs training because they are essential in the delivery of the knowledge, specifically in nursing or in other disciplines. And there has been researches that has found out that even faculty members are anxious with technology because most of the faculty members belong to the generation that they were not born into technology. They learn to adapt with the technology, but technology is rapidly evolving. They may find it very difficult to actually fully adapt. It needs to take time and training. So some of them are very much anxious with the technology. And another concern is that most of the faculty that lacks training will try to cope while they are teaching. For example, if I don't know how to use Zoom and I need to use Zoom to deliver my lectures, I will be trying to cope, trying to use Zoom and trying to find out how things work. And during this time, those encounters will be seen as uncaring by the student because it may seem that the teacher or the professor does not know what he's doing. Although you know your lecture, you know the content of your lecture, if the delivery will be problematic, then the student will not listen. And we need to remember one thing, that professors are human beings too. Now, we have this concern when we shift to a remote distance online learning because the space has been disrupted. What do I mean by space? Usually before pandemic, we know what we need to do because we are in that space. For example, if we are in the school, we know that we need to do work. If after the school you need to go home, you know that you are going home and you need not do work. So there is a clear demarcation between work and home, between student and family. But then again, during the remote online system, that space is disrupted. Everything now happens at home. So you don't know actually there is a blurring of spaces. When can you work and when can you attend to your domestic needs? And there is also another added burden of you actually trying to prepare for your lecture because all of your lecture used to be delivered in a face-to-face basis. Now, you cannot do that anymore in an online system. So everything needs to be recalibrated. So for some professors, lack of rest because of the preparation. Rest seems to be a luxury nowadays. Now, this is problematic in our educational system because the professors are very much essential. The worst case scenario that we can have is the professor resigning. So no one will teach what's supposed to be taught. And this is not a far-flung reality, no? This is happening at the moment. I know some of my colleagues have already retired or resigned their teaching post simply because they cannot adapt with the technology. And how can we actually replace them? We will find it difficult to attract future lecturers or professors in nursing. So what is essential in this is that there should always be a pre-planned mitigation strategies so that this thing will not happen. There should always be a plan A and a plan B. For example, if you're aiming for a blended approach, so that's plan A. If, for example, there is a lockdown, strict lockdown, then there must be a plan B, a plan C, and a plan D. You don't devise the plan when it needs to be done. You need to devise it before it actually needs to be used. Okay? Because we need to remember that it takes a community to educate a child. It does not only rely on the professor, the administrator, the government, and the school need to work hand in hand. And the last part of the talk is actually try to integrate this update into the nursing education. Now we will zero in into the nursing education. So we have three concerns in nursing education, and that is curriculum, course offering, and delivery. Now this one will be very much applicable to those who actually teach nursing courses. So let's start first with curriculum. So these things need to be clarified and discussed. Number one, there is a need to revisit the curriculum on a national and local level. I don't know the process in Indonesia, but we need to be constantly reviewing our curriculum, especially now that we are in a pandemic system. The question is the curriculum still responsive to the changing time? And we need to constantly ask ourselves, what do we want to have with our students? Do we want them simply to have skill, or do we want them to have the knowledge? Is the philosophy of our curriculum rooted in nursing or in education? Because they are different. And what way or what educational philosophy are we using? Is it pedagogy, andragogy, or otagogy? So we will discuss them one by one. So normally, this is how nursing courses are taught. Some of the nursing courses have basically three different components. One is the lecture or theoretical, then laboratory, and a clinical or the hospital exposure. Now, this is the problem here because this one is a KSA model. This is an educational model. Okay? It is not a nursing model. The core of nursing is caring, but it is not very much obvious in some of our curriculum. We don't focus on caring. What we focus more is the skill. Okay? I'm not saying the skill is not important. What I'm saying is that the knowledge is more important than the skill because the skill keeps on changing through time, but the knowledge stays the same. If you will be teaching students merely the skill without the knowledge, that skill will be obsolete in a matter of 4 to 5 years. But the knowledge needs to stay. So if you will be teaching them something that will be obsolete in 4 to 5 years, then you're teaching them something that will be useless in the future. And most of our curriculum is actually based on a medical model, not nursing. Okay. So those are our concerns with our current curriculum. Because the KSA, the knowledge, skills, attitude model, is actually fragmented. If you will try to analyze how you deliver nursing courses, lecture, laboratory, and clinical sometimes are not connected at all. But they belong in one subject, but they seem not connected at all. So that's a concern. Because if we will be shifting to an online system, a blended learning system, everything needs to be tailor-fitted. They need to be connected with each other. And at the end of the day, what do we want for our students to have? That is the main reason why we are trying to evolve or update our curriculum. Are we just trying to focus only on having a skillful nurses, or do we want a caring nurses? Because with the current model that we have, we are not actually explicitly developing caring nurses. We are developing them to be very much skillful, but sometimes lacking in knowledge. So this is actually a call for the nursing leaders, especially those who are crafting the nursing curriculum, especially in the COVID times. We have seen the importance of caring during the COVID times, not only on skill. Skill is just part of caring, but it is not the sole reason for caring. Caring should be explicit and central to our curriculum. If we want to deliver a proper curriculum in nursing, caring must be central to that curriculum. Because in actuality, your lecture should focus on nursing and caring knowledge, the laboratory on the acts and expressions of caring, and clinicals on the application of caring and knowing of person. Now, if this is your main goal when you develop your curriculum, it will be more easier to actually translate it in a blended system. Okay? Because at the end of the day, how do we evaluate our students? We're trying to evaluate them using the model of knowledge, skills, and attitude, not any model of caring. Okay? This is about time that we make nursing curriculum more nursing, not medical, and not educational. So these are the things that we need to understand. If you're a professor in nursing, what we actually use is the term pedagogy. But then again, we are very much lagging behind the idea because after 2010, it should focus now on the idea of pedagogy. Okay? In pedagogy, the teacher is the focus. In andragogy, the learning is self-directed. But in eutology, the learning is self-determined. It is actually part of the discourse of the student to actually say what they want to learn. And this should be the educational philosophy that we have in nursing, especially at the moment that we are in the pandemic era. Because they have different. Okay? In eutagogy, our center are the learners. Okay? The process is multidirectional. They learn from us, we learn from them. They are able to create things and know things. Our main goal is to cultivate knowledge in them. Gone are the days where we should be focusing on pedagogy. Okay? It's an educational philosophy of the past. But then again, why are we still using the same terminology that we used to have? And also, we should remember there is a very much difference between self-directed learning and self-determined learning. Okay? We should be focusing on the self-determined learning approaches, not self-directed learning. Okay? Now, we now go to the next problem in nursing education as an effect of the global pandemic, course offering. Now, I know that your courses is mostly determined by your university based on what is nationally accepted. But here are the updates and questions that we need to clarify. Number one, your courses should be outcomes-based, but it must be localized. What do I mean by localized? An OBE emphasizes a local context. So you have a national system for nursing, but your local problem is different from the national problem. So your curriculum, your courses should reflect answers to your local needs. Not only the national needs, but the local needs. Remember, we are, especially in the COVID pandemic, we are trying to educate and produce caring nurses for our own consumption, for the consumption of your locality. Gone are the days that we actually focus on producing nurses only for them to be exported abroad. Yes, some wants to work abroad, it's fine. But your main goal actually is to produce nurses for your own locality. So the system, the courses should be localized. At the same time, are your courses updated? Or you're still using the old system without trying to revisit it? How many courses? Courses is our terminology for subject. Do the nursing program have? Are all of these courses essential? Remember this one, if you are trying now to migrate to a blended system or pure online system, the courses offered should be those that are only essential. Because too much courses, too much subject in a single SEM will confuse your student. Online learning is not optimal when it comes to our culturing system. Okay? So we need only to focus on those things that are essential. The next question is, how many hours do we utilize in clinicals? How many hours of exposure? And how do we fit all those things in the blended learning approach? Now, I will share with you what we did in my university as we adapt the new system because of the pandemic. In our old system, we have 18 weeks per semester, and with that 18 weeks, we have 12 weeks for lecture and laboratory, then 6 weeks purely for clinicals. So this is the old system before pandemic. But after the pandemic came, we edited this one so that although we still have 18 weeks per semester, the first sem is pure lecture and the second sem is pure clinicals. Okay? Because we have adapted the system wherein we focuses on caring. So in caring, before you actually be able to do the clinicals, you must be able to know the caring knowledge first. So we finish every lecture in one sem, then on the second sem, all clinicals. And we have now a different system for lecture. In the old system, we have the 6 different subjects. For example, 6 to 8 different subjects at the same time for 18 weeks. So this is the old system. Okay? So it's confusing because you will have an ongoing 6 to 8 different subjects or courses in an online system. So what we develop is that we focus now on a more modular approach. So we only have 6 lecture courses for 6 weeks chronologically. So instead of having the 6 weeks all in all for 18 weeks or 12 weeks, what we did is change it so that we will have 2 subjects only for 6 weeks. Then after that one, another 2 subjects for 6 weeks. Then after that one, another 2 subjects for the last week. Why did we divide it this way? So that the student can focus. Because everyone is still in the transition period and we need the student to focus on single subject or 1 to 2 subjects per given week. Okay? So that they will not get confused of what is really happening. So in the delivery, how do we plan to conduct the lecture and skills demonstration? And a very basic question that needs to be answered is, in an online system and in the educational model of the present times, are faculty members actually lecturers or are we just facilitator of knowledge? We need to be able to understand that at this point in time, especially with the approach of Tagoji, we are not the keeper of knowledge anymore. We don't do lecture. We don't transmit knowledge. We facilitate its development. Okay? So these are the things that we need to emphasize, especially in the delivery system. Lectures should be modular. This is what we did. And it can be done pure online. This is for the safety of the student. For the skills laboratory, it can be blended. The lecture can be done online and the return demonstration done in the school on a specific time with specific group of people. For the clinicals, it should be controlled. Okay? Clinical exposure is controlled. So what do we mean by controlled? Now, there are some institutions in the Philippines who are using what we know as the bubble system. Later on, we will discuss the bubble system. But what we want to emphasize in the clinicals is that the school and the faculty should be able to deliberately define what do you want your student to do in the clinicals. Because gone are the days wherein our student in the clinical will actually do what the staff will be doing. Because they are not staff nurses, they are still students. So they need to be clarified of what are the things that I need to do while I am in the clinicals so that I will be safe during the clinicals and when I get home because the clinical settings are controlled already. So what you want to achieve, your goals should be explicit. So this is the goal of the clinical actuary, to know the person and to utilize your caring knowledge And I have discussed the bubble. So what do we mean by bubble? In a bubble, actually, they they contain the student with the professor in a place. They live in that place before they get exposed to the duty. Then in the duty, they cannot go out. They are just in the duty. Then right after the duty, they will go back to their bubble, to their place. Then that's it for a certain period of time. Then after that, they will have uh, 2 weeks rest period still on that bubble before they are able to come back to their home. Is it taxing? The short answer is yes. Why? Because we still don't have the vaccine in our place at the moment. If the vaccine is there, this might be able to change. But at the moment, this is how we do things. Okay? And the clinicals are clumped so that it is for the safety and ease of the faculty and the student. So they will do clinicals all at the same time for this specific set of period. Then they will do quarantine, then they will go home. Okay? We cannot expose them to the hospital every week because that will be too risky. Now, I want to share some of the flexible learning matrix that you need to define for yourself. For example, if you are teaching a nursing course, you need to be able to define for yourself what do you need to do. Okay? What is your learning matrix? So first question, how do you want it paced? How do you want your course to pace? Is it teacher-led? If it is teacher-led, will it be synchronous or asynchronous? If it is self-paced, the student, will it be guided or independent? The next question is, where will learning happen? Will it be residential, in a classroom or specific building, specific site? Or will it be remote? If it will be remote, do you need the internet? That's wired. Do you need no internet? That is non-wired. So yes, you can have a distant learning without the internet, but it will be troublesome. It's difficult, but it is doable. The next question is the process. How do you want the experience to happen? Will it be modular? And if it is modular, will it be printed or not printed? Will it be simulative? For example, you are handling a laboratory. Will the simulation be on-site or remote? And next is the product. How do you measure the learning? Will it be through a traditional approach, which can be either manual, they will submit things manually, send you, or automated, they will send you a hard copy, a soft copy of their output? Or will it be a non-traditional approach? For example, you're using a laboratory, you're teaching laboratory. Will it be an actual performance of the skill or a recorded performance? So these things need to be answered before you actually develop your module. For example, I am teaching the lecture on Introduction to Caring Science for the undergraduate. So I declared my subject to be self-paced guided, distance, specifically wired. It is modular and non-printed, and the traditional system of measurement and assessment will be automated. They will submit to me everything in via the LMS system, the learning management system. So my students know what to expect. They know that everything is self-paced. They know that it is wired. They know that it is modular, but it is non-printed. And they know that they need to submit things. So they basically know that they need the internet. Okay? And they know what to expect. And actually, also gone are the days wherein we always do what is traditional lecture. The traditional face-to-face lecture that could go on for more than 2 hours is not conducive on an online setting. The usual focus of a student is less than 1 hour. So beyond that, the student will not be able to focus anymore. So you have a different varieties of approaches to teaching and learning. Okay? So I will not go one by one, but here are some examples. You can have lead lectures. In lead lectures, you will invite key individuals to present and have their opinion. I have this actually in my class. We call it in Filipino as kapehan. In kapehan means we are discussing things over a cup of coffee. It's just a talk show, but we're discussing things with me and my fellow lead lecturers. Okay? You can also have group tutorials or seminars. You can also have critical reflections. You let them watch video and you have a central question that they need to reflect and answer that is related to your topic and the video. And also, you can actually do an independent learning strategy. For example, you give the student a concept that they need to develop and they need to read about. And at the end of the semester, they will submit a term paper or a concept paper. So it's not only lectures that we can do. There are a lot of things. We can also use art. We can use art expression to measure what they actually understood in our lectures. So again, in the curriculum, we need to understand that strategic policies and pedagogical adaptation should be enforced, but the programs and standard must be maintained. Yes, you can introduce adaptation, but the standard should be there. Okay? And at the same time, there is also a need for healthcare policymakers and regulatory board to put in place systems so that we can cope and recover from what is happening in terms of education. And what we have actually, this is to summarize everything. So, Levitt et al. In 2021, just recently, emphasized 4 points, 4 key points for a student success in online learning. This is actually what I've been talking about, but in a different lens. So, the policy should be student-centered, and it should provide maximum flexibility. You need to be compassionate in these times. Deadlines should be maximum. The delivery should adapt to the new system, and the lecture should not be more than 1.5 hours. You should devise a way wherein the student would be able to learn by themselves. You are there to guide them. You are not there to give lecture. You are not there to actually read what is in the book, or you are not there to actually present in PowerPoint what can be read in the book, because that's a waste of time. Because if the student can actually read it from the book, why need to lecture it in the first place? It's in the book. What you need is to discuss and clarify things. But the student needs to learn by themselves and for themselves. So we need an idea of dialogue that in this pandemic era, the students are also suffering, the faculty is also adapting. So we need to remember that the students are human beings as well. There are times that they might not feel right, and you need to be there to actually help them. Or if you cannot help them, to refer them to someone who can help. And we need to be open to the student in their availability time. For example, we also need to respect our own boundaries and time. So what I do with my classes is to announce my availability. For example, I will tell my student, I'm available every day, 8 to 4 p.m. Beyond 4 p.m., I might not be able to answer your question because I am focusing on other things. So they know what to expect. So if they message me and it's not an emergency beyond 4 p.m., they know that I will reply the next morning. That is an open dialogue and respecting your boundary as professor and the boundary of the student as well. And caring should be central to our curriculum. So there is actually a article that I wrote as the compassion as caring in a pandemic. I will share later with you the link so you can read all about it. But we need to be compassionate in this time. We are not only teachers, we are also human beings as well. And we need to see the suffering of our students as well. Not only as learners, but as human beings. So to summarize everything, these are the insights of this presentation. Number one, our transition to the new system is permanent. We need to be able to understand that we cannot go back to the previous system. We have no choice but to move forward, to embrace the new system. Okay? Next, adapting to the new system is a community approach. The lecturer cannot do it alone. They need the support of the administration. They need the support of the school. They need the support of the community. They need the support of the nursing organization. They need the support of the government. For this to be successful, we all need each other. And we need to recalibrate what we teach. We cannot do the teaching the way that we do it for decades before, because this is a new system. And we have a new set of students with new expectations. And we have a different context nowadays. So at the end of the day, the best approach is always a blended approach, but it will still depend on each school. So depending on your resources. And we need to remember that we are all on a transition. It will never be perfect in this point in time, but we need to make it work. Okay? It may never be perfect, but we need to make it work. This is a thing that we need to understand. We are transitioning, so it will never be perfect. And lastly, we need to remember that our goal as educators is to lead the students to nursing knowledge, not to transmit them. We don't hold all the knowledge, okay? But we know where and how to acquire them. So that is the thing that we teach to our students. At the end of the day, we need to develop nurses that can think for themselves, embody caring, and are lifelong learning, so that they can fend for themselves. We are not there in throughout their career as nurses, but we need to teach them to stand on their own. So here are all of the resources that I have read for this presentation. And these are the QR code. This is the QR code for caring in crisis situation. You may scan it now and use your QR scanner. And this is another QR code for the PowerPoint slide. Again, the first one is the QR code for a more material to read on how to do compassion in pandemic. And the one is the presentation slide for this day. And with that, I thank you.
Thank you so much, sir.
Terima kasih.
Terima kasih.
So I'm open now to questioning if you have any.
Yeah.
Thank you.
Thank you so much, Dr. Martinez, for your valuable information and your amazing explanation. So we will proceed to the Q&A session. And before the Q&A session, I just want to inform all of the participants here, because now is just midday prayer time for the Muslim. So please, everyone who need to do the prayer time may excuse the to the prayer room. And for others, let me proceed. Or our next session is Q&A. Anyone who want to ask the question for Dr. Martinez through chat room or raise hand? Anyone from the participant? Because we will wait for the participant for to ask the question. I just interest with your presentation, sir. So with your activity in San Beda University, what is your doing now? Online or offline or blended in San Beda University?
So at the moment, what we're doing is actually using now is pure online, because at the moment the government has not yet allowed us to have a face-to-face meeting. So we are using an online system. So at the moment we are pure online, but in the next semester, in the next academic year, that's next year, we are planning to have a blended system.
Uh,
So that
in
is the emphasis of my talk. For example, if even though we want to have a blended system, but the government will not allow us to have a blended system, so we cannot do away but bend with what the government wants. So we have plan A and plan B. At the moment, we are using plan A, and that is pure online. No, we are using plan B, and that is pure online because our plan A is to have it a blended approach. But it cannot be done at the moment. We need still to prepare for some things, and we need clearance from some government agencies. So what we're doing now is plan B, and that is pure online.
including the practical skill, also online, sir. For the laboratory skill, also online in
Yes.
Sanbeda. Oh,
At the moment, we are using a system wherein it is purely online. And although I don't teach laboratory actually, I teach lectures and theoretical. But my fellow faculty members who are teaching laboratory, they use an online system for demonstration, and some of them uh, have their student pre-record their demonstration at home and send to them so that they can grade it. But then again, we all know that that is not the ideal one. So what we're trying to do and what we intend to do after we are able to have a face-to-face, a limited face-to-face approach is that we will update those skills. So we will have the student practice when they want to at our skills laboratory. So they just need to fill up forms so that they will not be there at the same time. So that's part of the hotological approach. If the student think that he needs more to learn about IV insertion, so that's the one that he will focus. That's the one that he will practice on the skills laboratory. So that's the thing. So the teacher and the student will determine what they need and want to learn, and that is what we need in this modern time, specifically post-pandemic.
so for the evaluation or to evaluate the student skill, uh, what is the best solution, sir, or your experience there in Sanbeda?
Okay. Now, here's the interesting thing. Because of this shift, we are now refocusing our curriculum to make it more caring-based. And in a caring-based curriculum, we will be using rubric with specific sets of, or subsets to measure the skills and the other expression of caring from our student. Even before we have shifted from our old system, the KSA model, we are still using a rubric. So at the moment, we are using the rubric, but we intend to shift that rubric from a KSA model to a caring model. But we are using a rubric. So this rubric is essential because this rubric will be forwarded to the student even before they start the demonstration, so that the student know how to get the perfect score because it's in the rubric. So they know that they need to do this, do this, do this, do this, so that they will have a perfect score, even though it's pre-recorded. Again, our goal now is for the student to learn, not for us to grade them on the number of wrong things that they have done.
Yes, it's clear. Thank you, sir. And we have one question in the chat room from Mr. Widodo. Dr. Martinez, regarding your government regulation to apply blended learning system, how would you make sure for the last semester student learning achievement who have to finish clinical practice? Thank you.
Okay. Now that's actually a very good question. How do you measure learning of the student? Now, at the moment, we measure it based on the outcomes that they produce. And beside the outcomes, their feedback. Now, I cannot speak for the other university in the Philippines, but our system in San Beda at the moment is that we do not have a clinical exposure yet. We will have it next month. So we do not have a clinical exposure yet because our system, we changed the system so that everything is lecture first. We want to finish all the lectures so that we will have time to prepare for the clinicals. We do not have a clinicals yet at the moment. What we had were lectures and laboratories. And to evaluate the learning of the student, we base it on the outcomes that they have produced and the feedback that we have from them.
Okay, it's clear. So shifting the session from the clinical setting for the next period. And one question privately to my chat room. How do we react? How do we react to the difference in the material result of online lecturers and face-to-face lecturers? Because there is very little practice in the clinic or in the hospital. It's clear, sir? Is it clear?
So, if the question is trying to ask, how can you make the clinical exposure into an online system? That is very difficult actually. That's very difficult because we need human interaction.
Yeah.
We need to actually practice what we know in nursing, the nursing knowledge, and translate it into an act. You can only do that with another person. What we are doing is that we do it in the clinicals. Now, if we are to do it online, we cannot do it online because we need another person from which we can actually apply our knowledge of nursing. But it can be done. For example, if I will be handling, for example, next sem, we will be in a complete lockdown. So we cannot have any face-to-face. But the student has also an exposure to other people around their area, their family, their friends. So they can use the nursing knowledge to actually try to apply it to those people that they are having interactions with, even though that interaction is not within the hospital setting. Why am I emphasizing this? Because nursing is not only bound between the four walls of the hospital. The patient is not only within the hospital. The patient is whenever a person needs care, whenever the person have concerns, that is a moment and an opportunity for nursing. If we are that is the reason why we are shifting to a caring-based curriculum. The focus should be the caring, not the skills. Because if we will focus on the skills, then that is problematic because we cannot do away but practice the skill to another person. And if the government does not allow it, then you will have a problem in your curriculum. But if your curriculum focuses on caring, you know that your main goal is to know the other person and practice your caring knowledge. Sir, how about the skill? How can they practice it? They would be able to practice it in the laboratory when it is available. You can always practice the skill in the laboratory, but the application of knowledge, you cannot practice it inside inside the hospital most often than not. Again, the hospital setting is what we know as the clinical setting. But we need to understand that the clinical setting is not actually only within the hospital. It can be done in the community. And your student belongs to a community.
Okay.
So you can use that actually.
Okay. Thank you so much for your explanation, sir. I think because we have limited time and we still have 3 remaining speaker. So let us give reaction with the applause reaction in the Zoom for Dr. Martinez for giving lecture in the topic of impact of COVID on nursing education and future learning strategies in nursing student. So before we proceed to the next session, I would like to give certificate of appreciation to Sir Rudolph Seymour Kirby P. Martinez PhD as a speaker for this international seminar held by Faculty of Nursing Sultan Agung Islamic University Indonesia from the Dean of the Faculty of Nursing Sultan Agung Islamic University, Mr. Iwan Ardian. Thank you so much again for your time, for your best explanation, amazing explanation. I hope you can share again in the next period or in the next international seminar. Maraming salamat po.
Terima kasih.
Ya. Okay, for next session, we will have another speaker, but I will change to be participant, and the session will be moderated by Mrs. Indah. And thank you so much. And I hope we learn a lot from our foreign distinguished speaker today. And please forgive me if I make mistake in to be the moderator of this session. Thank you so much. Assalamualaikum warahmatullahi wabarakatuh.
It was inspiring talks and discussion from the first plenary sessions. Thank you very much to all the distinguished speaker and the moderator. To the participants, please fill in the attendance form and evaluation as a condition for getting a certificate. And for participants who are joining the YouTube room, as a condition for getting a certificate, please like, subscribe, and comment. Thank you. To all participants, we would like to proceed the second plenary session. This second plenary session will be led by Mrs. Indah Sri Wahyuningsih, MCAP. Now, I would like to read the CV of Ms. Indah. Full name, Nurse Indah Sri Wahyuningsih, MCAP. And for formal education, Master of Nursing Medical Faculty di Ponorogo University Semarang from 2014 until 2016. And then for the occupation, she is a lecturer in Faculty of Nursing Sultan Agung Islamic University from 2013 until now. And then she is a secretary program of Bachelor of Nursing Sultan Agung Islamic University from 2019 until now. And then for the reward, there are committee service for Ministry of Research and Technology from February 2019 until February 2020. And then for the list organization, she is a member of Internasional Critical Care Nurse Association for 2015 until now. And then she is a member of Adult Nursing Department at Faculty of Nursing UNISSULA from 2013 until now. To Mrs. Indah, please welcome.
Thank you for the Master of Ceremony, Ms. Rindang. The Honorable Mr. and Madam Speaker, participant, ladies and gentlemen, good afternoon. Assalamualaikum warahmatullahi wabarakatuh. First of all, I would like to welcome you all to this international seminar about uncovering the world's nursing learning strategies during COVID pandemic era in 2021. Before I will continue our seminar today, let me to introduce myself to be your moderator in second plenary session. My name is Indah Sriwahyuningsih. You can call me Miss Indah. I would to say thank you very much for all of committee in international seminar and our presenter or our speaker today. They are going to present about nursing learning strategies during COVID pandemic. Okay, before I'm going invite to presenter today, I will read one by one agenda in second plenary session. The first session is introduction, second session is presentation time, third session is panel question and answer session, the fourth session is closing. Well, ladies and gentlemen, before we show our presentation, let me introduce the speaker. Our first speaker is Ms. Wahyu Endang Setiawati. Please welcome. Could you hear, Miss? Well, Ms. Wahyu Endang Setiawati will deliver presentation entitled University Readiness in Facing the Pandemic Period as COVID-19 Prepared Campus. I will read curriculum vitae. She is Ms. Wahyu Endang Setiawati, SKM MKEP, lecturer at Faculty of Nursing, UNISSULA, concentration in mental health nursing. Vice Dean 2 in 2019 until now. She also the Secretary of Task Force Team COVID-19 in UNISSULA. Her educational qualification is follow. In 2012, she attended her Magister Nursing degree from Erlangga University. Now she is studying doctoral student in Erlangga University. I think she is very capable to presentation about it. And ladies and gentlemen, please welcome Ms. Wahyu Endang Setiawati, SKM MKEP. Time is yours.
Okay, everyone. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, all. I'm so glad to meet you this afternoon, and thank you for the time given to me. And today I'm going to talk about university readiness in facing pandemic period as COVID-19 prepare campus. Okay. Because the time is running out, I will try to speed up, about our material. Okay, from the first slide, university readiness in facing the pandemic period as COVID-19 prepare campus. Okay. Okay, anyone can help me to share material, please? Okay. Okay, for the next slide, please. I'm sorry. Okay, can you see our the screen? Okay. Okay, everyone, keeping physical possible, but don't reduce our enthusiasm to share knowledge today. Jadi boleh kita physical distancing, tapi semoga tidak mengurangi semangat kita untuk berbagi pada siang hari ini. Okay. This about COVID-19, and then a public start from March 2020, public start to receive information about pandemic. UNISSULA built task force team for prevention and handling of COVID-19, which focus on in prevention, management, and implementation of health protocol. We call maybe the name is Pandawa COVID-19. Okay. Spraying the disinfectant solution, I think this is the same from your place. And then either indoor, outdoor installation of wastafel through the unit and faculty, provision and hand sanitizer, mass procurement, face shield, and so on. Okay. Come to UNISSULA. In Ramadan month, UNISSULA assists from the impact among them students who were still living in Semarang, and then students who were in internship program outside Java giving a shoulder packet, and then takjil, breakfasting, and sahur assistant during Ramadan, and then also parcel for community in need before Ramadan. This is about handling action. And then internet quota assistant, deduction for UKT, uang kuliah tunggal, a single tuition for higher education according to impacted condition. This is handling action too. And then SOP, standard operational procedure about entering UNISSULA environment, and then SPO or SOP about handling COVID-19, and then SOP about self-protection, about guest, visitor, about tracking those who confirm positive, and then standard of facilities and infrastructure in era COVID, and then maybe health status screening application period self-check. How do you get the COVID-19? This is a perform self-check screening at least once a week, weekly, and then monthly too. www.corona.unisula.ac.id. This is about how to reporting, tracking, compliance, monitoring civitas, and progress status for weekly and monthly. Okay. All UNISSULA civitas academica must wear a mask from the house and while at work. Okay. Take the body temperatures, no more than 37.3 Celsius. Okay. This is about how to hand washing before entering the office. Maybe we can say about this, yeah. And then how to safety code, etika batuk, physical distancing, and then establish of COVID-19 prevention task force in each faculty or unit. Yeah, every unit, every faculty have to make task force COVID-19. And then each faculty unit provides hand washing, stand in front of the interest and indoor. And then each faculty and unit provide education media like this, prevention and spread of COVID-19. Okay. Open air fans for a better circulation. Yeah. This is a safety first. And not treating positive case as a stigma. Yeah. This is about comprehensive action from bio, psycho, socio, spiritual, and cultural. And then this is about the comprehensive action. Okay, office, classroom, laboratory, clinical setting, we have to concern about that. The existence of the COVID-19 house is a means of self-isolation, breaking the chain of transmission, comprehensive treatment program, multi-sector volunteer cooperation, and then collaboration between UNISSULA, and then hospital, and then Amil Zakat Infak and Sodakoh Institution, or we can call LAZIS UNISSULA, LAZIS Sultan Agung. Okay, this is about COVID-19 dormitory, or we can call pesantren COVID-19 UNISSULA as the good solution when our civitas need self-isolation. This is the building. Before the pandemic, this building was used for student dormitories. But when the pandemic occurs, it is used to accommodate academician and the big family who confirm the COVID-19 and need a house to carry out about self-isolation. Okay, this is the building, the room, one person, one room, this one. So comfort and very sociality. Okay, comprehensive university. Why we call a comprehensive university? Because readiness, physical, psychological, social, finance, and then spiritual. This present of COVID-19 dormitory or pesantren COVID-19 UNISSULA very helpful, very meaningful, sangat berarti. Why? Become a solution for those who need to have self-isolation. Not all members of the community have building that meet self-isolation standard. Okay, breaking the chain of transmission, kita harus putus mata rantai penularan COVID. And then program offered, what is the program? Physical, psychological, social, and spiritual. Okay, ini beberapa gambaran yang bisa dilihat di situ, bagaimana how we can action about comprehension, bio, socio, spiritual, social, cultural. This is about the curriculum of LAZIS Sultan Agung, and we can discuss every day for 14 days when we get sick and then need to self-isolation via Zoom meeting to make all feels better. Okay, this is the situation about how to pendampingan seperti itu untuk bisa memberikan pelayanan yang terbaik. Semangatnya adalah memutus mata rantai. Okay, this is the situation. Okay, how about the result? Okay, everyone, the result about the building on pesantren COVID-19 or COVID-19 dormitory is or are the first is satisfactory, kepuasan, and then for the second is comprehensive healing. Comprehensive healing. Why? Because about physico, socio, bio, socio, cultural, and spiritual. And then fast healing, sembuh dengan cepat. And then breaking the chain of COVID-19 transmission. Why? Because all of activity is breaking the chain of COVID-19 transmission, memutus mata rantai. Okay, we can believe where together we can, and we believe that all of this effort, will be very meaningful in the breaking the chain of transmission of COVID-19 UNISSULA. A million thanks. This is the Pandawa COVID-19 chief is Mr. Andera Dr. Gigi Andina, Dr. Gigi Dr. Gigi Andina, and then and all the team about the Pandawa COVID-19. Mr. Rosit, Mr. Rosit, and then Mr. Rudy, Mr. Andina, Mr. Prima, and me. Okay, everyone with UNISSULA being the best generation. Thank you so much. We can share about Pandawa COVID-19 and then share about the building, about the pesantren COVID-19 UNISSULA. Thank you so much, and wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Oh, thank you for your presentation and sharing, Mrs. Indang, and also experience management COVID-19 in UNISSULA. Greeted. Let's give once again a big round of applause for emoticon in room Zoom. For the participant, if you have any question for first speaker, please you can write in the chat box in Zoom or YouTube streamer. Well, ladies and gentlemen, next turn is for the second speaker. Please welcome Mr. Suyanto. Could you hear, Mr.? Mr. Suyanto as a staff quality assurance unit at UNISSULA. He is candidate of Doctor in Nursing at Erlangga University. He will deliver presentation entitled Quality Assurance in Learning During Pandemic Era at UNISSULA. Please welcome Mr. Suyanto. Could you hear me?
Okay, I hear you, Miss Ida. Thank you. Thank you for your announcement for myself. Okay, I will share my slide. Okay, Bismillahirrahmanirrahim. Okay, thank you for the committee and the Dean of Faculty of Nursing UNISSULA and Vice Dean first and then second Vice Dean and Head of Nursing Program, Bachelor and Diploma and Professional. Here I will share about experience in quality assurance and learning pandemic COVID-19 at UNISSULA. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Okay. As we know that UNISSULA vision is a leading university in building generation let me share what the meaning of generation of Earth. The definition of Khair Ummah is the best alumni of UNISSULA to make definition of good Muslim. Not only in cognitive, but also attitude, akhlak, and the others competence. Hopefully, after graduate from UNISSULA, they can build Islamic civilization in community. But as we know that in pandemic COVID-19 in 29 until this day, and in Semarang, count of person who have COVID is increased. And like President of UNISSULA, Mr. Bejo, give a policy that in UNISSULA, we have to move from offline method of learning to online learning fully. accept our nursing program because they have course of clinical practice in laboratory actually, and then in hospital. But because of move method from offline to online, based on Mr. Martinez, he said that a lot of weakness from the instructor, student, and then facilitating. But President of UNISSULA make prepare to ensure that quality of learning in UNISSULA still on the track. How to make sure about it? Rector make policies that UNISSULA must be implementing the internal quality assurance system. Why? Because in internal quality system, we have 5 steps. 5 steps in the step first is planning, the second one in implementation, evaluation, control, enhancement. The 5 steps in UNISSULA implementing actually in pandemic because a lot of weakness that we have because as we know that as to all students in UNISSULA spread around Indonesia, they have good internet. The same student they poor internet. So to make sure that quality assurance is with 5 steps. Okay, Rector. In planning, you have 2 policies. The first one is determine on learning guideline, and the second one is determine guideline of new adaptive in campus. In determine guideline of new adaptation in campus, we collaborated with team task force Pandawa with Miss Endang actually to discuss about how prepare not only student but also lecture and the others one before they come to the campus or they make activity at the campus. Okay. This is a guideline of learning academic in the pandemic. The first one in academic guideline in UNISSULA, and we spread to online learning guideline and guideline of new adaptation. Guideline of learning and adaptation in campus, we communicate to the dean or the other unit in UNISSULA to make sure they adapted the guideline actually in nursing program, because as we know nursing program have different learning outcome actually about the skill and hospital environment that students have to hospital in because they must hands on. But the other situation, we should know the pandemic is increased. Okay, this is content of guideline and learning. The first one is all course use learning method online, except the priority activity. Just like skill laboratory and then hospitality skill practitioner. In UNISSULA have one single learning management system we call is SIP Academic UNISSULA. But lectures can combine with the others online learning. Example, Zoom, Gmeet, or the others application. Skill-based course requirement learning or exam on the skill laboratory allowed by fulfilling the requirements. Students have filled out the form willingness to take part in learning at the UNISSULA campus by head protocol and must be known by their parents. It's so important because the parent must know what the student to do in campus and must to know what the impact if the student came to the campus. And then maximum 4 hours a day per group and divide into several shifts in several groups. In the implementation of final assignment and skill-based completion activity that require practice and clinical practice skill, the common coordination intensely by the study program with related. Okay. And in the implementation of learning outside the campus must carry out with synchronized or unsynchronized. Basically, to achieve the learning outcome, especially the skill, nursing program actually have a requirement to the student should be upload the video for the skill, and then their student and then the lecture or instructor can be assessed about their video. Okay, the other strategy is evaluation of internal quality assurance. The first one is health program, actually, nursing program, monitoring and evaluation of learning activity. The second one is unit of quality assurance in UNISSULA, implementing the internal audit, especially for program study. The third is the implementation of learning satisfaction survey for lecturers and students. This is a structured organization of our unit, especially quality assurance in UNISSULA. We have rector, vice rector, and then unit of quality assurance can coordination with dean or the other unit in UNISSULA. Basically, quality assurance unit has coordination with dean, not direct communication, but be coordination. Okay, the first one about report of monitoring and evaluation, lecture and learning actually. Our activity is every head of program study, especially in nursing, make report include learning process about learning activity, lecture activity, student activity, how many lecture came to the online learning, and the extra. Why the head program must be monitoring policy? Because head program have to ensure that lecture carry out the learning out according to the learning plan semester. Because if have this spread between plan and realization, we can imagine that maybe learning outcome of course can be achieved of the student. Head of program study to ensure the achievement of student learning outcome. Report of monitoring and evaluation. Head of nursing program or head of program study implementing into time in a year after final exam every semester. Okay, the second evaluation is implementation of learning internal audit. Scope of internal audit is about learning standard. The first one is about graduate competence standard, and then learning process, learning education assessment. We implementing on 2 times in 1 year, especially after semester. The mechanism is audit process actually with online, and then auditee has upload their files, learning file actually to the Google Drive, and then auditor will be downloaded and compare with instrument of audit to looking for the finding. And then if auditor and auditee, when auditor make finding atau or finding something, and then between auditee and auditor discuss about finding, maybe good or bad finding, and then make a deal how to solve the bad finding. This is the picture of activity audit internal assurance in the Faculty of Nursing. We have dean, and then first 15 and second 15, and discuss with auditors. Every auditee have 2 auditors minimum. Maximum is 3 auditor. Okay. The last one is learning satisfaction survey. Respondent is learning lecturer and student. Frequency 2 times a year. I will find examination every semester. The purpose is to know about satisfaction. Actually, lecture on and student with the service provided learning. And then after we get the data, nursing program or every head of program study improve services in the next period. But sometimes student or lecturers do not honest to fill the form. I don't know what the reason, but maybe the field is as fast as they can, and I don't think they read the question. Okay. And then last but not the least, Prophet Muhammad SAW said that today must be better than yesterday, tomorrow must be better than today. So as a Muslim, we have to improve our quality, not only in learning process, but also the other aspect in of our life. Maybe the last slide of my presentation. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Mr. Indra.
Okay. Waalaikumsalam warahmatullahi wabarakatuh. Thank you for your great sharing experience, Mr. about internal quality assurance system in UNISSULA. Thank you, Mr. Suyanto. Now, ladies and gentlemen, let's welcome our third presenter. She will deliver a presentation entitled Adjustment of Student Learning Process to Online Method During the COVID-19 Pandemic. Before she will deliver presentation, I will read curriculum vitae. She is Nurse Nutrisia Nuim Haya. Her educational qualifications are as follows. In 2010 until 2011, she attended her nurse degree from Institute of Health Science Karya Husada Semarang. And in 2014 until 2016, she attended her Master of Nursing Education degree from Muhammadiyah University of Yogyakarta. She also has many publications in nursing education. Now, ladies and gentlemen, please welcome Nurse Nutrisia Nuim Haya. Time is yours.
Okay, thank you, Ms. Indah. Are you clearly? My voice clearly?
Loudly, please.
Ms. Indah? Okay.
Loudly, please, Miss Nutri.
Okay.
Okay.
You hear my voice?
Clear.
Okay. Thank you. I will do share screen. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Peace be upon you. Raditu billahi robba bil islami dina wa bi muhammadin nabiyya wa rasula. Rabbi sohli sodri wa yasirli amri wa hlul uqdatan min lisani yafqahu qawli. Praise to Allah, the most glorious and the most merciful. Salawat and salam to our Prophet Muhammad sallallahu alaihi wasallam. Honorable audience and speakers, and my loving student in nursing faculty of UNISSULA. I'm glad to see you. Okay. Okay, here we will sharing. Yes, next teacher sharing about the adjustment of student learning to online method during the COVID-19 pandemic. Okay, we all know if the effect COVID-19 is pandemic, not only in our country but all over. So we must stay at home. We must work from home, and this effect for us that we must do all of our life, not always, but what's our work, our study on online like that. So this is give us any confusions. I mean, any period of online learning method. So the one period or first period that maybe we not sure or feeling can if we can do of online learning method during the pandemic. How to do? That's in our brain maybe, yes. So the introduction period, that maybe we first to do it. Maybe we have first to do it because we can choose the other. We must do it like that. So we go to period of trying that there is already traction. So start trying many application. Maybe the first we get that WhatsApp maybe. So we have Zoom, we have Gmail and the other application. So we go to convention period. In on convention period is we have accepted and seen the ratio, and we have optimism with the online learning method. So we we go to inauguration period. In this period, we have deal. We will choose with what application we will choose to learning method like that. So in here we have comfortable learning, but there is what this is we know if there is a deficiency in the online method. There is the soft skill, laboratory skill, affective, and psychomotor. We all know if this is all can be able if with just with online method. Okay. So next. But we must optimist with the online method. This we can do to teach and learning with students. This is a positive effect of online learning. This student will familiar with online method. Not student, yes, but teacher too. And student center learning is easily facilitated in here. So students are familiar with project-based learning directly, project-based learning directly, and problem-based learning too directly in community and family nursing. Okay. So this is the beneficial for the environment itself for mahasiswa, for students that in set community nursing or community nursing. This is mahasiswa students, and this is too we can do learning in community. So for overview of learning success during pandemic, you must know about our successfully in during a pandemic. This is a certificate of the best institution in our country to exam Indonesian nursing competency. In here we make proof and very satisfaction in here. Okay, and this is there is we are the best faculty in UNISSULA about degree grant. Okay, and then this is academic program. We until today we have 60 students have passed the examination in 7 semester from 95 students until this day, until today. 70 students have passed the thesis, and we get about 300 students in this years. And this is we call class go start to work. There is this in Sari Hospital Ciputat photo is before the pandemic, and this is Bahterama Hospital too before the pandemic, and there is this Sari Asih Hospital in Cipondo. So there is a new Islamic Hospital of Sultan Agung terbaru. This is so. This is maybe and we ready for blended learning, and so you never give up on your dream. Like that. I think that's for from me. Thank you. The time for Miss Indah. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Mrs. Nutrisia, a great sharing and explanation. Let's give once again applause reaction in Zoom for Mrs. Nutrisia. Okay, and next session, we will deliver discussion session for 3 presenter or our speaker. Any question for 3 presenter or our speaker? Okay, I see one question in box of the Zoom from Mr. Wahid Hasim. The question is, I think, for Mrs. Endang. The question is how spiritual well-being method as a spiritual intervention for COVID patient in clinical setting.
Okay, thank you for Mr. Wahid Hashim. We can show from our slide, that there are many activity from the Zoom. We can discuss about how about your physique, how about your feeling, how about your condition today, yeah, and then from the all of condition we can give a solution to present many some person who has given the discuss about the spiritual meaning. For the example, we can joining from hospital, a person from hospital. For example, Mr. Samsudin, he has chief of spiritual in Sultan Agung Hospital, And then from Zoom too, we can discuss about whatever, about how to get feeling good when we get sick. And then, for example, for me, for the sometime I can sharing about the patient who get confirm COVID-19, about how to ventilation feeling, how to get channeling feeling, and then we can input about the meaningful of spirituality. And when I give the material, I give my material with the model, with the method. The method is storytelling, for example, like that. Okay, like this, Mrs. Indah.
Okay, thank you, Mrs. Endang, for your explanation. I hope the participant satisfied with your answer. And then I see at the box of the Zoom room, is there any question from Mrs. Nurlaili? Mrs. Nurlaili, raise hand in Zoom. Please mention your institution and state to which presenter you address your question.
No. Goodbye.
Oh, okay, thank you, Mrs. Nurlaili.
No question.
Yes, clear. Okay, thank you, Mrs. Nurlaili. Any question again? Okay. Well, I will see it's a great presentation for our speaker in second plenary session. Thank you to the speaker. We appreciate for the material, and please to receive certificate as a speaker at international seminar. First for Mrs. Endang. We will appreciate.
Okay, thank you. It's wonderful certificate. Thank you so much.
Thank you so much, and you are welcome, Mrs. Endang. Okay, and then for second speaker, Mr. Suyanto, we appreciate with your explanation and giving me experience to all participants. This is for you, Mr. Suyanto.
Thank you, Miss Indah. Thanks a lot.
You are welcome. And then the third presenter or third speaker for Mrs. Nutrisia Nuimhaya, Nurse Nutrisia Nuimhaya MKep. This is for you, Mrs. Nutrisia.
Okay, thank you, Miss Indah.
Okay, you are welcome. Okay, ladies and gentlemen, finally we come to the end of presentation. We would like to say thank you again for all the presenters for their informative and interesting talking, and to audience for your active participation. Hopefully the presentation will be beneficial for everybody. Thank you for your attention. Good afternoon. Assalamualaikum warahmatullahi wabarakatuh. Time is yours for Miss Rindang.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
It was inspiring presentation and discussion from the second plenary session. Thank you very much to all the distinguished speakers and the moderator. Ladies and gentlemen, We have had productive and inspiring time together, and this few hours of international seminar is about to come the very end. Well, we do hope that this international seminar will give you a great memory of Nursing Faculty Universitas Islam Sultan Agung Semarang, and that memory will invite you back to attend our second international seminar with them, developing knowledge, skills, and technologies in nursing on March 13th, 2021. Ladies and gentlemen, we now come to the end of this seminar. On behalf of the host and committee, we would like to extend once again our deepest appreciation to you all for your support and participation. Once again, thank you. Billahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Salam.